What's up, world? What we doing out here? What's up, world? Hey, today is Monday. Monday. We are going to go over, of course, NCLEX style questions. So I'm going to give it some time for y'all to jump up here in the chat, and then we're going to get it on and popping. So shout out to everybody that's jumping up in here. Army wife, I see you. I see you up in here. I see you. Y'all tell me, hey, how was y'all's weekend? How was y'all's weekend? Hey, if you're new in here, I want to know who you are, where you're from, where you're at in your nursing journey. You know, we out here trying to make moves. You know what I'm saying? So hopefully everybody had a good weekend. Everybody, hopefully was safe. So, hey, Army wife, you already know what we about to do. We about to go over some NCLEX questions. So, you know, drop your expertise in the chat for everybody that's up in here. So whenever we get stuff ready and we get enough folks up in here, and we'll get it on and pushing. So there's about 5 people up in here. So, hey, if you're new here, welcome. My name is Kevin. I go by the Boot Nurse. We're going to be doing NCLEX questions. Make sure you guys smash that like button. I want to know who you are, where you're from, where you're at in your nursing journey. Got Army wife here, and she been a nurse for a while. Doesn't do bedside anymore, but still a nurse nonetheless. So let them know, Army wife. Let them know what you about. Let them know where you work at. Let them know what you're trying to do. So you already know we over here trying to foster a great environment down here in the chat, and of course, everywhere else, and at least in the nursing field. So I'm working until I hit the lottery. Look, what does that even mean? Like, what does that even mean anymore? Talking about that 1.5 billion, because I ain't even been paying attention, and of course that come across my TikTok, and I'm just like, oh, there goes that monies. Your boys needs that monies. So I had drill all this weekend. So speaking into existence. Oh yeah, you're right. Speaking into existence, and it shall be so. Right. Put it out there, and the universe shall give it back to you. So when I had drill this weekend, for those that don't know what drill is, it's military. Weekend for military reservists, and that's fun. It's always fun, I guess. So it depends on your unit. I guess it could be worse for where I'm at, but it is what it is at that point. So shout out to all 9 of y'all that are up in here. So my husband had drill too. Look, it must be that time of the month for drill. Okay. Anyways. Shout out to all 9 of y'all hanging out here. Welcome. We want to get a good amount of people up in here before we start. But I want to know who you are, where you're from. If you're new, I want to know who you are, where you're from, where you're at in your nursing journey. Taking the NCLEX, are you a nurse? Are you a nursing student? Did you just start school? Do you start school today or tomorrow? Have you been a nurse for a while? All that good jazz. Like let's talk about it. Let's talk about it. And what questions for all those new nurses or soon to be nurses? Like, what questions do you have? I've been a nurse myself for 3.5 years. I've worked in ICU, OR, and PACU. I enjoyed my time while I was there hanging out. But sometimes you got to go. Any of my seasoned nurses feel like, like after 3 years, you're just like, man, it's time for me to push on to something else. Anybody else feel that way? Shout out to all 47 of y'all hanging out in here. Because that's what I think the median is. And like in the Navy, when I was active duty, like it was anywhere from 3 to 5 years and you were moving, like you were going somewhere else. And, because you always essentially got to start over and try to build up leadership and, build up your skills. I'm at that 3-year mark and I'm just like, yo, bro, I got to go somewhere else. For those that don't know, I started as LPN to 03, RN in 14, and BSN in 19. So that's another thing too. That I really hate that confuses people is when you say RN, people think that RN is a degree, and RN is not a degree. RN is a license. I don't want to be a nurse anymore. Look, I don't blame you, but RN is a license, y'all. All right. I hear somebody's like, hey, does it make sense if I go get my RN and then my BSN? I was just like, your RN is your license. You know what I'm saying? So you have an associate's degree as a nurse. And I was like, so now you're going back to get your bachelor's degree. You still are an RN, whether you have a bachelor's degree or an associate's degree. All right, so don't get it mixed up. And I think that's the huge misconception. All they see is RN, and they get big, but they don't realize it's just like, oh, it's only a 2-year degree. Not saying there's anything wrong with that. Not saying there's anything wrong with that, but I'm just keeping it in a stack. So is it Iman or Eamon says, do you recommend LVN? I do. If LVN is the route that you want to go for yourself, and if it's financially feasible for you, I would definitely do it. Is it easier than RN? Definitely would not say that, because if you don't have any type of experience, hell, people that do have experience in medicine don't do well when they go into an LVN program. So it's definitely not easier, but if it's definitely a stepping stone, or if it's definitely the way that you want to go, cool. Hello, just have 4 months left of my ADN. Any tips for is it predictors? I would definitely go over those big sections such as pharmacology, management of care type. I would definitely go over those, because those are going to be a big bulk. I'm starting the program in January and start prereqs in October. Shout out to you. Get those prereqs knocked out. I feel like LPN school is harder because it's faster paced. It all just depends on the program. I went through an 18-month accelerated BSN program, and it was not a joke. It was not a game, and it was not to be played with. Hell, there's actually 15-month accelerated BSN RN programs. Not a joke, not a game. So it all just, like I said, it all just depends on you and you as a person. RN school is hard. LPN school is hard. Becoming a nurse is hard, regardless. Your first semester is what they call the weed out, or what we call the killer. So that's where you see people that you'll see the bulk of your folks falling out and not making it. So, but yeah, shout out to all y'all. Got 55 people up in here, so I think we're good to go. Hey, we're gonna do NCLEX questions today. I did have a request on Friday to do some NCLEX questions, but I got busy, so I didn't get a chance to kind of grab them. So we're gonna go off of another quiz that I had. Which is fine, which is good. Y'all already know I don't gatekeep. You already know where I got them from, and I'm going to show you where I got them from. So we're going to go through questions. Make sure you guys smash that like button. But if you're new here, I want to know who you are, where you're from, where you're at in your nursing journey. Been a nurse for a while. What do you do as a specialty? Are you a nursing student? Are you a prereq student? Let us know down in the comments. We got Army nurse that's down there, or Army wife, I'm sorry, who's down there. Got tons of experience as an RN. Of course, worked as an LVN as well. Then you got Nurse Nelly down there, another one of the co-hosts who's been a nurse for 4 years. She now works in case management and loving her life. Make sure y'all go over there and y'all follow them. And any questions that I may miss or I may not be able to answer, they will answer. And yeah, we'll get it. We'll get it on. So hey, who wants NCLEX questions? Because that's what we finna do. Accelerated BSN student. Shout out to you. Is that Kristen? Shout out to you, Kristen. I've been there. I was in one of those programs as well. And they're not easy. They're not easy, right? Because there's a lot that you got to do. So there's a lot that you got to do. Kat said me. All right, Kat, I got you. Is that Mika says she's taking her NCLEX soon? Shout out to you, Mika. Hey, you gonna be all right. Y'all gonna be all right. Hey, last week on Friday, we had 2 to 3 people take their NCLEX and they passed, and they came out here and they let us know what's up. So I'm just saying, like, this is the community that you want to be a part of. Like, if you do well, let us know. If you don't do well, let us know. Like, you see what I'm saying? Because you're going to come over here and you're going to be like, man, I failed it. I don't know what to do. Look, I don't coddle. If you ain't ever been here before, I don't coddle. I don't do nothing like that. You're coming to me with a problem, you better come with a solution. I'm gonna give you the straight, I'm a straight shooter about the whole thing. Straight shooter. He drops gems, hit that like button. Hey, shout out to you, Silver. I appreciate it. But hey, look, I'm just letting y'all know, you come up in here with an issue like that, you gotta get it together. I failed my NCLEX 3 times. Three times. All right. So, but no one will ever ask you that. No one will ever ask you how many times you failed your NCLEX. Nobody will ever ask you what school you went to. They're just going to be like, oh, all right, cool. When can you work? Because they putting that ass to work. Best believe me when I tell you that. All right. So, who is that? It says, I'm starting my entry MSN program soon. And man, I'm just ready to finish already. Look, you about to get started. An MSN program, they're going to put you through the ringer. So, but hey, getting that master's degree can definitely help out in a lot of ways. All right. So we about to start these NCLEX questions. You already know how I do. We're going to go through the housekeeping stuff first, and then we're going to go into the questions. So let's get this thing on and rolling. Money. I hope everybody can see that. Your boy was trying to make it bigger, but poor out here. Poor. think that's good. There we go. There we go. There we go. All right, cool. Hey, you already know. You already know what the deal is. Let me bring this down some. All right, everybody should be able to see that. Hey, give me a thumbs up in the chat if you can see that. Hey, give me a thumbs up in the chat. Hey, make sure you guys share this too. Make sure you guys share. Make sure you guys smash that like button, all that good stuff. Hey, because if you don't give me no likes, you don't get no questions. Yeah, I said it. Today's Monday. I ain't playing no games. I will 600 everybody in this chat. I'm just playing. I'd never do that. All right, here we go. Here we go. Here we go. Hey, welcome. So we're going to be, no, go away. All right, cool. So, hey, we're doing NCLEX questions. All right. So participation is the key. I want you to participate. Let me know what's up. I'm kind of, sort of, not really, but really funny. Sometimes. Depends on how I feel. The more that you like or give gifts or whatever, the more questions that you get. But whatever, you do you, boo. You do you. What we get for answering the questions correct. A nice pat on the back and feeling real good about the fact that you know the answer. So there's that. Guess how many likes I want? I want them all. I want them all. I want all the likes. I'm saying last time, look, I think I had 50,000 likes, you know, and a cowboy hat. And some roses, you know, like that, like the lady that walks outside the bar, you know, when you're sitting outside with the smokers and she's just like $5. And I'm like, sure, whatever. So more you give, the more you get, you know what I'm saying? I need 10,000 followers. That's a 10. That's a 10K. I need 10,000 followers so I can stream from the computer, you know, so I don't have to be ghetto out here. So yeah. I always talk about the 7-day NCLEX course. 7-day NCLEX course is in its pre-launch phase. It's a course I created, and it's exactly what you think it is. It's an NCLEX course. It's going to have content. It's going to have NGN stuff. So it's in its pre-launch phase right now. It's for $48, 80% off. Once you buy it forever. It's yours. So that link is in the bio. Make sure you guys go over there and check that out. Kristen, I am from Texas. I am from great country of Texas. Next thing, don't troll my chat. Do not troll my chat. If you troll my chat, I'm going to troll you. And everyone else in the chat will troll you. If you've been here long enough, y'all already know what I expect, right? If you troll, you're getting a 600. For those that are new, what is a 600, you might ask? 600 means 600 seconds, which is equal to 10 minutes. And that's how long we're going to ban you. But in reality, we're not going to ban you for 10 minutes. We're going to ban you forever. All right. And I just like saying 600 because it's cool. I heard one of my favorite YouTubers say it and I just adopted it. So I just think it's funny. So, and if I miss it, and if anybody's in here coming in here acting crazy, telling me that I'm yapping too much, or if you don't like it, or don't listen to me, or I'm a scam, or whatever stupid shit that people like to say, sometimes I like to do this on a democracy. I'm like, chat, what do you guys think? And then next thing you know, I see everybody dropping to 600. I'm just like, oh, well, okay. Hey, and Nurse Nelly, she paying attention. I'm just saying she's paying attention, and she will give them a 600. I'll just be like, Nelly, there's somebody in there and she's like, I'm on it, and she will block them. All right. Once again, we brought with a constructive criticism. Don't come in here acting a fool or that ass is banned. All right. So here we go. No, I don't gatekeep either. I got these questions from nurseslabs.com. Not only does nurseslabs.com have these NCLEX style questions or whatever, they also have like NANDAs. They also have, what else do they have? They have NANDAs, nursing diagnosis, all that good stuff. So if you're a brand new nursing student and you're trying to figure out those care plans and all that other good stuff, they got a bunch of stuff over there for y'all. All right. So without further ado, we know the rules. Here we go. Definitely a chatterbox. Hey, you ain't been here before, so you about to really find out. All right. Let's get this on and pop. And I really should get a timer, but you know, I'll be trying to give people so much. So here we go. Here we go. After exposure to hot weather and sun, clients with signs and symptoms of heat-related ailments rush to the emergency department, right? Sort clients into those who need critical attention and those who need less serious conditions. So we're going to put these in order, all right? We're going to put them in order by critical to least critical, all right? So we have what does it say? A healthy housewife who states that the air conditioner has been down for 5 days, who exhibits hypotension, tachycardia, profuse diaphoresis, and fatigue. An elderly traffic enforcer who complains of dizziness and syncope after standing under the heat of the sun for several hours to perform his job. A sportsman who complains of severe leg cramps and nausea and displays paleness, tachycardia, weakness, and diaphoresis. and an abandoned person who is a teacher has an altered mental status, weak muscle movement, hot, dry, pale skin, and whose duration of heat exposure is unknown. What's up, Sandy? Sandy, we just started. This is the first question. We just started. This is the first question. So, hey, so we're going to put these in order. Is it A, B, C, D? Is it C, A, B, D? Y'all tell me the order of how we're going to do it. All right. So who is the most critical? Who is the most critical? When we think about most critical, we're always thinking about ABCs, right? But here's one thing I'm going to throw out to you guys. Think about the patient's level of consciousness, okay? I think it's the teacher who needs to be seen first. Okay, but put it in order. I want them in order. So if you're telling me C, okay, there we go. Is this tropic tropic says D, B, C, A. Okay. So D would be an abandoned person who is a teacher. That would be the first one. All right. Yeah. Put them in order. Put them in order. Don't just tell me that it's not the right answer if you just give me one answer. I need 4 answers. So I need to know what order. Nizzle for shizzle, says D, B, A, C. Okay. Grace says D, cab. All right. So when we're thinking about the most critical based off of the questions or the answers that were given, what are we thinking about? Like, what are those critical things that we want to see? We talk about airway, breathing, circulation, right? But also think about an altered mental status. An altered mental status can tell you a whole bunch about a patient. Okay. So even though the rule of thumb is ABC, it's more like LOC ABC, if that makes sense. So level of consciousness plus airway, breathing, circulation. All right. Somebody said something up in here about found something. Let me see what y'all are doing. I think it's the teacher who needs to be first. Okay. I see you. This is the coolest live I've been searching for nursing. Okay. Hey, Kristen, I got you. Army wife says says DBAC. Okay. All right. I'm gonna give it a couple more seconds. You know what? As a matter of fact, I'm about to see something. I'm about to see something else. See if I can. Y'all got that over there. Here. Since people want to get mad at me for the fact that, oh my God, you're taking too long. So I got a stopwatch up here. And altered mental status is first. Okay, cool. All right, so let's see what the answer is. So the answer is, there we go. B, D, C, A. There you go. D, B, C, A. First, you want to have the abandoned person with the heat stroke. Right? The abandoned person has symptoms of a heat stroke, a medical emergency, which heightens the risk of brain damage. Talks about a CNS dysfunction involving injury to the gut, kidney, skeletal muscles, and other organ systems. The elderly traffic enforcer is at risk for a heat syncope and should be instructed to relax in a cool environment and withdraw from approaching related circumstances. It represents a temporary self-limited dizziness, weakness, or loss of consciousness during prolonged standing or positional changes in a hot environment, including physical activity. Okay. I know I'm a chatty Cathy. I'm just saying. I like to talk. That's why I'm a teacher. If I didn't want to teach, then I'd go hide in a corner somewhere. A sports person experiencing heat cramps, which can which can treat with rest and fluid, and then a homemaker who having heat exhaustion and management, including IV or oral fluids in a cool environment. All right. Okay, let's go ahead and subscribe because I'm a senior. Hey, go ahead and subscribe. Go ahead and do that. All right, cool. I think we got a good understanding of this. So we put that in order. So the most critical. So when you guys are thinking about especially when it's a management of care question, definitely think about level of consciousness plus ABCs. Okay. All right, so here's question number 2. The ambulance has transported a man with severe chest pain. All right, so paint that picture. Severe chest pain. Paint the picture. As the man is being transferred to the emergency stretcher, the nurse assesses the following: the patient is unresponsive, cessation of breathing, and absent of palpable pulses. Which of the following tasks is proper to assign to the nursing assistant? Is it aiding with oral intubation, performing chest compressions, placing defibrillator pads, or is it starting BVM ventilations? What do we got? Since everybody got mad, y'all got 30 seconds. Got B. Okay. B. We got some B. Got a C in there. Okay. We got C. So remember, this is a delegation question. right? Me as the RN, what can I delegate? What can I tell you? What can I tell that patient, right? Oh, I'm sorry. What can I tell the UAP or the CNA or the nursing assistant or the med tech, whatever, right? Now I need Jeopardy music. I know. I wonder if they have Jeopardy music on here, if they even let me do that. Absence of breathing. It's just cessation of breathing is what is absence of breathing. You can't delegate what you eat. That's true. B, I just had this on ATI. Shout out to you, Janine. Okay. You gonna die on that hill, Janine? You sure? You sure about that? You sure? Can a nursing assistant deliver chest compressions? That's a good question. Can they? I just want to, so here's the thing. Here's a good question for you. Who is BLS qualified or CPR qualified in the hospital? Right? Is a UAP or a CNA, are they all BLS qualified? Right? CPR qualified? Me? Okay. All right. Yeah. So if they're CPR qualified, does that mean that they can do chest compressions? Yeah. Everyone at the bare minimum, even down to the volunteers, are BLS. All right. There we go. Everyone in clinical setting. Shout out to y'all. All right. So here we go. See what the answer is. Of course, the answer is B. We're going to perform chest compressions. Basic cardiac life support is learned by nursing assistants so they can perform chest compressions. Now, during a code or anything like that, obviously they can't push meds. They can't scribe. They can't do anything like that. Okay. Essentially a CNA or a medical assistant or whatever, they are just doing chest compressions. They are the muscle. You know what I'm saying? Because all the CNAs out there and all the UAPs got the muscles around there. Y'all feel me? Certified nursing assistants deal directly with the patient. So they must have, or they must be pulmonary resuscitation certified or CPR. It obviously just wants to be long for no reason. It is the nursing assistant who witnesses the victims of cardiac arrest and become an immediate responder. A trained certified assistant can easily cater to instantaneous needs of the patient. All right. So everybody down to the CNA, down to the UAP or the tech or whatever, everybody at the basic level is BLS certified. Okay. Techs are, certain techs are not ACLS or techs are not ACLS. Okay. So think about that. I think we're good. Go on to the next one. All right. A high school student comes into the triage area, alert and ambulatory, and his uniform is soaked with blood. Okay. So paint the picture. You got a teenager in high school coming into your ER soaked with blood on his pants, shirt, or whatever. He and his classmates are saying they were running around outside the school and he got hit in the abdomen with a stick. All right. So obviously he just ran around. Which statement should be a priority? So this is a priority question, right? So who do you see, or what will be the thing that would kill this patient if you did not assess him quickly, right? So what is it? The stick was absolutely filthy and muddy. He has a family history of diabetes, so he requires attention right now. He pulled the stick out because it was too painful for him. There was plenty of blood, so we used three gauzes. All right. Everybody got C up in here. I see C. I don't see. Oh my God. Right. Hey, so here's the thing. It's like you're dealing with high school kids. Most high school kids, like 90% of them, 95% of them, what do they know about medicine? What do they know about anything? Right. Most of them know something about medicine if they're playing Call of Duty. You know what I'm saying? If they're out here just like playing Call of Duty, thinking that they can stim pack themselves, like, bro, it ain't like that. You know what I'm saying? You ain't going to stab him. You're going to be good to go and get up and running and gunning. That's not how we do. That's not how life works. All right. So we got C's. You know what? I think 30 seconds is too short. It takes me at least a minute 45 to read the whole damn question. So, oh, them stems do wonders. Look, I'm just saying, hey, got to res them. You got to res them, bro. You got to get them up. All right. So we got C's. Okay. Shout out to y'all. Yeah. Give me a minute. Oh, Esmeralda says C. Okay. Hey, so we're at a minute. All right. So I think I'm going to do a minute 15. See how everybody else is doing. All right. Shout out to y'all. Appreciate everybody for the follows. Thanks everybody for the follow. Hey, make sure you guys smash that like button. Vanessa says C. Smash that like button. Yes. Is that Selena? Selena's? Yes, I am an RN. Very much so. All right. Here we go. Let's see what the answer is in 3, 2. So the answer, of course, is C. He pulled the stick out because it was too painful for him. Well, let me tell you something. He about to be in a lot worse issue than the pain. He ain't gonna feel the pain, come soon because he might just bleed all over the place. An impaled object may be given, may be given a tamponade effect, and the removal can result in abrupt hemodynamic decomposition. Surgery is often required. Impaled objects are secured in place so they do not move, and they should only be removed in the operating room. And that's also true. What's up? Who is that? Nick Hall. What's up? How are you? You said you've been here the whole time, and now you're here. I got you. What's up? How are you? All right. Hey, so everybody got the general consent. He's like, do you have any farm tips? You missed it, Selena. You missed it. We did farm last week. That's fine. Anyone who complains about, who keeps scrolling and finding, yeah, they can do that. Who's complaining? Who's down here complaining? Y'all funny. It's all good. Shout out to all 98 of y'all. We'll go on to the next question. I don't think no one really has any questions about that. I feel like some of these are kind of self-explanatory, but I know some of the wording of a question will really throw you off. All right. So here goes number 4. A mother is worried that her son took an unknown amount of children's chewable vitamins at an unknown time. That's why we never tell kids that medicine is candy, ever. While in the emergency department, the child is alert and asymptomatic. Asymptomatic obviously means without, not showing any symptoms. What information should be directly stated to the physician? The child was nauseated and vomited before arriving to the ED. The child had been managed multiple times for unexpected injuries. The child had been treated many times for ingestion of toxic substances. The ingested child's chewable vitamins contain iron. All right. So what do we think? We got A, salute. Oh, that's also another thing. You come up here and you act a fool, I'll give you the finger and this finger and then this finger. All right. What's the answer? What are we doing? Natalie says D. Natalie. A or D. Okay. A or D. All right. We got A, D. Vanessa says A. All right. What else we got? Shout out to all 170 y'all. Appreciate everybody that's dropping the likes and dropping the follow. Make sure you guys smash that like. Hey, the more likes that you give, the more questions that you get. I'm just saying, I need Pete's help. Well, you can't get Pete's help right now. Except for this question. Remember, they always decompensate fast. Always. Jay Quellen says D. Okay. I got my eye on you, Jay Quellen. I see you. Hannah says D. All right. What we got? All right. Let me see if I can get this last part of that question up in there. There we go. All right. I'm going to give it about another 15 seconds. See how y'all are doing. All right, we got D. Vanessa's laughing. What? What's funny? What'd I say? Fitness, B. Okay. Charlie Pickles says A. All right, cool. Appreciate it. All right, let's see what else we got. I wish I could have some music on in the back, but I feel like I'm gonna get demonetized. I don't even get monetized. You know what I'm saying? So here we go. All right, I'm gonna drop this answer. Where's AA round? Look, I don't know where AA round at. We need one up in here. We need everybody in here. I'll be the substitute teacher, Mr. Garvey. Here we go. All right. So the answer is D. The ingested children's chewable vitamin contains iron, right? Iron is a toxic substance that can lead to severe bleeding, shock, hepatic failure, and coma. The antidote that can be used for severe cases of iron poisoning is deferoxamine. Iron poisoning is one of the most common toxic ingestions and one of the most deadly among children. Failure to diagnose and treat iron poisoning can have a serious consequence, including multi-organ failure and death. Shout out to everybody that's following. Oh, good to know. There you go. Bye. I'm about to fail the NCLEX. Nizzle, what you mean? What do you mean? Yo, you gotta practice. Right? You gotta get through that anxiety, and you gotta get through that fear. Oh man. Wow. You're like, all right, I'll see y'all later. I'm gonna just jump off. No, don't do that. I can take the NCLEX in January. Shout out to you. I just want to call you Jay Quellen now. So that's your name. That's your name in the whole chat. Jay Quellen says she's taking her NCLEX. Okay. I'm sick of it already. Look, let me tell you, I studied for this. I failed the exam 3 times, y'all. 3. You count it. 1, 2, 3. 1, 2, 3. That's how many times I failed. I took it 4 times and I passed it on the 4th. So how do y'all think I feel? Right? However, I do this because of me failing 3 times. Right? Y'all got this. All right. Y'all got this. All right. Stop playing with me. Y'all can do this. All right. Question number 5. What it says, several clients arrived to the emergency department with the same complaint of abdominal pain. Designate them for care in the order of severity of their condition. So who is the most severe and who is the least severe, kind of like how we did with our first question. Okay, so let's see what it is. You have a 42-year-old woman with moderate right upper quadrant pain who has vomited a little amount of yellow bile and whose symptoms have worsened over the past week. A 68-year-old man with a pulsating abdominal mass and sudden onset of tearing pain in the abdomen and flank within the past hour. 53-year-old man who experiences discomforting mid-epigastric pain that is worse between meals and during the night. A 38-year-old man complaining of severe occasional cramps with 3 episodes of watery diarrhea hours after meals. A 12-year-old with a low-grade fever, anorexia, nausea, and right lower quadrant tenderness for the past 2 days. Or a 25-year-old woman complaining of dizziness and severe left lower quadrant pain who states she is probably pregnant. So remember, we're putting those in order. We're putting them in order. So you got what, A, B, so that's 2, 4, you got 6, right? We got 6 of them. So I need to see everybody put 6 answers. Y'all are going to get a little bit more time, so I want y'all to put these in order. But somebody said something about what was number 2. So think about it. Hey, there are certain words that stick out that will tell you like, I should probably get homeboy first. Or I should probably get homegirl first, right? So let's think about this. Right upper quadrant. Right. And they're vomiting yellow bile. Right. What is yellow? What is that an indication of? Think about it. Think about it from pathophysiology. Right. You say B is first. OK, well, what's the rest of them? Thanks for the follow. Is that Cassie? Dallas says liver. Right. So what's attached to the liver? BFEACD. Shout out to you, Jenna. BDEFA. All right. Michelle, I see it. Matt says BEFADC. Gallbladder. There you go. Gallbladder. There you go. Right. B is first. That's an AAA. That's right. I mean, I agree with you. I'm not saying that is first, but I do agree with what the condition is. Right. So think about it. Like, who do I want to see first? Somebody who's coming to me telling me about a pulsating keywords, pulsating abdominal mass and it is sudden. It's not gradual. It's a sudden onset of tearing pain in the abdomen within the past hour. Think about it. Think about that. Right? I have somebody who has discomfort, mid-epigastric pain that worsens with eating or with meals. Eating. B, about to meet Jesus. Look, okay? Look, Scarlett, I'm not even about to do it. You're not about to rope me in. Nope. You ain't about to do it. That is reflux. Okay. So if it's reflux, so what order do I want to put that in? See, I was thinking F, but then when you reread, yep, B is good. B is a good one. All right. Hey, so I'm going to give y'all about like another 30 seconds. All right. Before somebody get in my chat and start yelling at me, telling me to answer the question or go to somebody else's live because this guy talks too much. Shut your ass up and answer the question. I love y'all. Appreciate y'all. Hey, hey, make sure you guys share and hit that like button. Oh my God. Hey, I had a nap before I got on here. I'm just letting y'all know. So we Gucci out here. All right. Hey, y'all got 4 seconds. Here we go. Y'all ready? Here we go. In 3, 2, 1. All right. So there's your answer. It is BFEADC. All right. Now let's see what B had. Pulsating mass is experiencing an abdominal aneurysm that may have ruptured, and he may be abruptly deteriorating. So, yep, I'm just gonna say that if you have an abdominal aneurysm, yep. That's all I'm gonna say. So the woman with the lower quadrant pain, which is F, is at risk for an ectopic pregnancy, which is life-threatening. Okay. So essentially, if you guys don't know, for those that don't know what an ectopic pregnancy is, essentially egg got fertilized in the fallopian tube and stayed in the fallopian tube, where that's not where we want babies to grow. We want them to grow inside of uterus. Okay. Or on along edges of walls of uterus. Okay. 12, it says she needs evaluation for appendicitis, right? So she has an inflamed appendix. For who is this? For A, gallbladder, right? So think about a cholecystectomy. The man that's 38, he has food poisoning, right? And then for the guy with the epigastric pain, he may have an ulcer, right? Could have an ulcer, could have a hiatal hernia, something along those lines. Okay, but definitely, my man that is having that pulsating abdominal pain, and it's abrupt, and it happened within an hour, and it's, oh man, y'all got to see him first. Y'all got to see him first, because he's going straight to the OR once he gets evaluated by whomever in trauma. All right. Oh. Hey, so now we're at a break. So if you're new here, we do a break about every 5 questions. This is why it takes so long for me to get through questions, is because 1, I try to talk. I give you guys time. We go in depth. We talk about all kinds of stuff. And then every 5 minutes, we do a recap, try to rope everybody in, make sure we all understand the rules and all that good stuff. But anyways, hey, if you're new here, my name is Kevin. I go by the Boot Nurse on all social media platforms. Make sure you guys go over to my bio and you guys check out everything that's in my link tree. Check out my YouTube, Instagram, all that good jazz. Participation is the key. I'm kind of sort of funny, but not really. But, if you don't like it, that's cool. And I'm all right with that. My feelings don't get hurt for nothing. All right, so here we go. So the more that you like, the more questions that you get. I have a good amount of questions today. If I don't get a good amount of likes, then I'm just going to stop at a certain number. I'm going to be like, hey, we good to go out here. We good to go out here. All right. Guess how many likes y'all got to dish out? All of them. That's right. Not a few of them, not some of them, all of them. Hey, Fairy Tale, Mary Kate, ma'am, don't you worry. I'm going to let you know what a 600 is. You about to find out. No one cares about anything I got to say until they were just like, what's a 600? I'm about to let you know what's up. We need 10,000 likes, y'all. I need 10,000 followers. 10,000 followers so I don't have to be ghetto like this with the phone and this. Even though this works, I don't want to do it no more. I want to do it from my computer and a nice fancy camera over there. It makes it easier, right? So 10,000 followers so I can stream on the PC. So shout out to y'all. Make sure you guys follow. Make sure you guys share. That's the biggest thing. Share this to everybody that you know that you think will need it. It doesn't matter if they're pre-nursing, if they're a nursing student, or if they're prepping for NCLEX. Hell, even if they're already a nurse, share it to them. I don't care. You see what I'm saying? So, I always talk about the 7-day NCLEX course. What is that? That is my course that I created essentially because I never want another nursing student or nursing graduate to feel the way that I felt. I felt lost. I didn't know what direction I was going. And then I finally figured it out because I had some type of mentorship. And I created it based off of the way that I studied. It's in its pre-launch phase. It's going for $48. Once you get it, you get it forever. NCLEX, easy as fuck. Don't waste your time here. Oh, we got one. Oh, we got one. We got one, y'all. We got one. Hey. We got one. Nelly, I know you see it. I know you see him. There, that a girl. That's what I'm talking about. Yo. Anyways, check out the 7-day NCLEX course. Once you get it, it's forever. $48 and you get it forever. And I'm updating it all the time. All right. Updating it all the time. Are you saying appreciate it? Are you telling me appreciate it? Who? So, hey, all right. Anyways, it doesn't matter. So there's that. So make sure you guys check that out. Hey, don't troll my chats. You troll my chat, you get a 600. So somebody just asked me what a 600 was. And I'm going to tell you, a 600 means it's 600 seconds. 600 seconds means or equals 10 minutes. 10 minutes is how long I'm going to ban you. But in reality, I'm going to ban you forever. You see what I'm saying? So you come into my chat, you act a fool, I'm going to ban you. You come into my chat saying stupid shit, I'm going to ban you. You come into my chat talking to other people like you've lost your ever-loving mind and like you weren't raised with manners, I'm going to ban you. So yeah, there's that. All right. So a 600 means I'm going to ban you. I don't know how many times I said that. But act up, I'm gonna ban that ass. Okay, so there we go. And also, I don't gatekeep. Somebody asked me where I got these questions from. I got them from nurseslabs.com. They also have really good stuff over there for nursing students for like when you're learning nursing diagnosis, NANDAs, all that good stuff, especially for those that are learning about those damn care plans, right? Yeah, the care plans, the bane of every nursing student's existence. You see what I'm saying? So now that we got that under control, and now that we got that understood, now we're going on to the next question. Am I on time for this? Hey, we already got through 5 questions, so now we're going on to question 6. It says, understood, we're all just trying to be good nurses, appreciate that. Hey, look, that's all. In the end, that's all it's about. It's about you being a good nurse. It's about you being a good and a safe nurse. This is why we do this, right? And like I said, I don't gatekeep. Y'all can go on nurseslabs.com and go find them yourself. I like to do this because I like to facilitate. I love to teach. I've been an instructor / educator for 8 years. I'm a master instructor in the Navy, and this is what I like to do. So, hey, if you don't like it, don't come into my chat talking shit. Just leave. If you don't like it, then leave. Okay, here we go. Question number 6. A newly hired nurse is in his or her first week on the job in the emergency department. He used to be a traveling nurse for 5 years. Which area in his present job is the most appropriate assignment for him? So essentially, he's been a nurse for a while, but he just got hired somewhere. So it's just like being a new grad, or, like right out of school. So since he's traveling and he's doing something different, like, okay, where do I want to put him? Right? So sometimes you gotta reword the question so it makes more sense to you. Don't reword it to the point to where the question is wrong, because then you're gonna get the question wrong. All right. So we have A, fast track clinic, B, pediatric medicine team, C, trauma team, D, triage. I'm thinking fast track clinic. Okay. I'm thinking you may be right, or you may be wrong. I guess we won't know until we get to the next, to the answers. Kaylin says D. Is that say Tipsby? Tipsby says A. CC says A. Jigglypuff, you're one of my favorite Pokemon, says A. Trace says D. I think triage. All right, Maria, I see you. Shout out to everybody for the follows and the likes and the loves. The loves. I like all the loves. All right, I'm gonna give you guys another 20 seconds. Lacey says triage. Okay, Lacey. I would ask you guys why, but then we'll sit on this question for a long time. We'll sit on this question for a very long time, and we don't need all that. He's been a traveling nurse for 5 years, so he's got experience. So I say A. Okay. So let's reread this. It says a newly hired nurse is in his first week on the job in the emergency department. He used to be a traveling nurse for 5 years. Which area in his present job is the most appropriate to assign him? Sometimes you got to really emphasize, like, hey, it's his first week on this new job, right? And it says he's a traveling nurse, but it didn't say what type of traveling nurse. And then you got to think is like, what is the basic skills that a nurse can do no matter where you put them? Okay. All right. So here's our answer in 3, 2. Fast track clinic, right? So the ambulatory or fast track clinic deals with relatively stable clients or patients or whatever, however you want to call it. The decision of whether or not to delegate or assign is based upon the RN's judgment concerning the condition of the patient, the competency of all the members of the nursing team, and the degree of supervision that will be required of the RN if the task is delegated. Hello, I can't see anything. I don't know what that means. Are you trying to say like you can't see anything because it's too small because I can't help you there? Maybe I can. Maybe I can. Nope. I guess not. I tried. I know it's tiny. Hey, if I had 10,000 people follow me, I could stream from my computer. You'd be able to see the whole thing. The caption code. What you mean? Where we at? Oh, I'm sorry. Here we go. My bad. I got you. So let's do that. Can y'all see that? Hey, thumbs up if you can see that. Thumbs up if you can see that. I know it's tiny. Better? Got it. Got you. Okay. All right. Everybody got a good understanding of that, though. It's just like I could have really reworded this question and just said like, "Hey, I'm a med surg nurse that got floated to labor and delivery." Right? I know nothing about labor and delivery, but I do know the basics of nursing care. Right? So what do I need to know in regards to nursing care? I'm not going to send a med surg nurse into a room where a woman is actively in labor, about to push. Oh, I can see the head and the head is crowning. That's not what we're going to do. Okay? So think about it on that aspect. All right. So the answer was A. So shout out to everybody who picked A. All right. Number 7, a client with multiple injuries is rushed to the emergency department after a head-on collision. What the fuck? Which assessment finding takes priority? Right. So he's on a head-on collision. Right. So paint the picture. You outside driving Miss Daisy, doing whatever, and then some Uber driver wasn't paying attention and bow, head-on collision, right? So now what is the priority, right? Irregular apical pulse, ecchymosis in the flank area, a deviated trachea, or unequal pupils. I say C. Natalie said, sorry, I read that fast. Okay, so here's a question. If you're new in my chat or if you're new here, what is my old saying? RTFQ. I don't think option D does a good job explaining why it wasn't D. Here's the thing. It's just like you may not agree. You may not agree with the rationales. I didn't make them. And even if I did make them, not all, like out of 100 questions, maybe like 5 of them would be funky, right? 5 of them would be funky. In the last question. No, I hear you. I assumed it was that one. Deviated pupils. Wait, what's it? I'm sorry. Yeah, deviated pupils is already unalive. You mean dilated pupils? I'm assuming, Jigglypuff. ABCs, first people. Yeah. Agree, DJ. Yep. All right. I'm going to give you guys another 20 seconds. See what we got. C, airway. Okay. A deviated trachea, right? Unequal pupils is first priority. So what does unequal pupils mean, Nizzle? What does that mean? What does that tell me? What system does that have to involve with? Big one, little one, right? So big, yeah. So big one, no, that's a head injury. So if I have unequal pupils, meaning I have one big and then one super tiny, what does that tell me on a neurological level about them? I'm gonna get to the answer, y'all. But increased cranial pressure. Yeah, could. Possible TBI as well. Well, traumatic brain injury, right? But if they have unequal pupils, it'd be different if they had equal dilated or equal constricted pupils. You see what I'm saying? So isn't ABC? So ABC priority framework, right? It means that there's neurological injury, possible cerebral. Yeah. Oh, okay. I don't know what you're yelling at me for. I'm just asking. But the answer is a deviated trachea. Okay. All right. A deviated trachea is a symptom of a tension pneumothorax, which will result in respiratory arrest if not managed. The first question in the triage algorithm for triage nurses is whether the patient requires immediate life-saving interventions or simply is the patient dying. So here's the question. Is the patient dying or is the patient already dead? Right? The nurse determines this by looking to see if the patient has a patent airway, if the patient is breathing, and if the patient has a pulse. You knew it. Shout out to you. I was about to say Martian, but it's not. It's Martini the Martini the Dalmatian. Shout out to you. Dying, right? So remember, when it comes to triage, it's like life, limb, eyesight. You know, who can I essentially who would I save first, or who needs saving? Okay, so here we go. On to the next one. Bye, y'all, for real this time. Well, Nizzle, you ain't going nowhere. Stay right where you are. Stay right where you are. You getting these questions and you getting these answers. All right, you getting them. This is what we call we got to educate ourselves. This is what we got to do. All right. Shout out to all 137 of y'all. Keep smashing that like button. Hey, make sure you guys share. Hey, we're on question number 8. Several people were killed and injured in a recent industrial explosion. So think of somewhere like Beirut, where they had a real big uranium nitrate or whatever explosion that killed 300 people, right? Think of something like that. The victims are being interviewed and assessed by the nurse for possible psychiatric crises. Which client has the greatest risk for post-traumatic stress disorder? An individual who was injured and trapped for 8 hours before rescued, a person who saw the death of a coworker during the blast, an individual who recently discovered that her daughter was killed in the incident, or D, a person who repeatedly watched television coverage of the event. Can't really see all the sentences. Let's see. It says B. Taylor says B. Who said that they couldn't see the sentences? Is that Lilu? Lilu, can you see it now? That's better? Okay, cool. I don't know why it's doing that. I don't know why. See what happens when it's ghetto and people don't love me? Okay? You gotta love me. You gotta follow me so you can get all these answers, all right? God. The caption covered the text. Lord have mercy, bro. What is happening here? Oh, the caption's covering the text at the bottom, for the chat. Okay, I'm tracking. All right, so what are we thinking? We got A's, we got B's. We got A's, B's, B because of the death, okay? Hey, there's only going to be one answer, but PTSD is a different... I honestly don't like this question because you honestly can get PTSD from watching a coverage event. Or if, you just anything. You can get PTSD from a lot of things. So this is a very like gray type of question. I don't really like it, but it was one of the ones that they had. And I figured, let's put it in here, I changed my answer and I didn't read it correctly. So, hey, that's the thing. RTFQ. What does it mean, people? What does RTFQ mean? If you've been here long enough, I say it all the time. What does it mean? What does it mean? So you better do it. I say, this situation is personal for this person. Okay. Read the freaking question. That's right. Sometimes you can use another word and I'm okay with that. I just don't want TikTok to ban you. All right. So shout out to all 270 y'all up in here. Make sure you guys smash that like button, share. We're going over NCLEX questions right now. If you don't know what NCLEX questions are, those are questions that nurses for LVNs, LPNs, and RNs take for their licensing exam. So I'm in my first semester of college, my nursing degree. So hopefully I get this right. Hey, if you don't get it right, it's okay. Because this is why we do this. We practice until we understand. See, daughter. All right, cool. I'll give it about another 10 seconds. See what y'all got. No, I won't. Here we go. Here's the answer. So the answer is A. An individual who was injured and trapped for 8 hours before rescue. Any of these victims may need or require psychiatric counseling. There will be changes in previous coping skills and support groups. Nevertheless, the individual who encounters a threat to his or her own life is at the greatest chance of having psychiatric difficulties following a disaster incident. So like I said, any one of these people could have PTSD, right? Any one of them can have PTSD, but it's like, who is likely? And it's the person who is most directly affected, right? Okay. I see it now. Good job, guys. Next. Oh, are we on your time? We on your time now? Mr. Patel, are we on your time now? All right. We'll be on your time. All right, here we go. Question number 9. When several areas of a daycare center collapse due to an earthquake, children, especially injured ones, are brought to the emergency department. As a competent nurse, you know that children will be more predisposed to which of the following. Select all that apply. Oh, yeah, I know y'all love these. Is it bradycardia, fracture of long bones, head trauma, hyperthermia, hypoxemia, junctional arrhythmias, liver and spleen contusions, or is it lumbar spine injuries? Select all that apply. Shout out to everybody who's sharing. Shout out for the follows. Shout out to the follows. All right, I'm gonna go through some of y'all's questions and see what y'all are saying. Exposure to traumatic events. There we go. I'm a nurse. Yeah. That key. A. Practice. Shout out to you, Brian, for getting that last question right. Best answer always get me. Right. So here's one thing I'll tell you guys about best answers. If you could do one thing and leave, what would it be? What is the one thing that you could do and leave that would save your patient? Okay. If we're talking about best questions, if I could do one thing and leave, what would it be? Now, if it comes to priority questions or who do you see first, it's exactly what you think it is. Like if I have 4 things listed out, what is the number one thing that I want to start with that is going to save my patient's life? All right. Air. Oh, okay. Well, of course, air. Michelle, really? Naomi, okay. We got No Name says oxygen. Select all that apply. You already know it. You already know the deal. Select all that apply. Okay, I'm guessing. Hey, I'd rather you guess than not answer at all, because you never know. Head trauma, because kids and their big ass heads. I'm just saying that because I have a son and he has a big ass head. All right, so we got BCDE, BCEH. All right. Sorry if you guys hear him in the back screaming. I don't know what his issue is. He is crazy. He gets it from me. First of all, you know what? I can't even give you a 600. Oh my goodness. All right, cool. Hey, I'm gonna let you guys go for like another 30 seconds. All right. Because this is select all applies are definitely those ones that are super tough. All right. All right. So think about a child. Think about a child. Like, what are the things that they're susceptible to, right? They have big heads. They can decompensate really, really fast, have fast heart rates, fast respiratory rates, right? So think about the things that that a child can, something that will happen to them. And so when it does happen to them, you think about those things like right off the bat. Okay. All right. So here's your answer in 3, 2, 1. So it's C, D, E, and G. Now, this is really small. I know for a fact that y'all can't see this. And it says, so we'll start with C. What's the answer for C? It says they have proportionally larger heads. Just like I said, for them to have head injuries or trauma. Y'all hear him? Y'all hear him? Jesus Christ. Every single time I do something, this boy always got to scream about something. When one looks at an average growth chart for a child who has reached the age of 18, it can be seen that their steepest curve is from 0 to 2 years of age. And it says from the age of 2 to 18, a child experiences more growth in the size of their head, reaching a full size of 54 to 60 centimeters. Now for D, hypothermia is more likely due to their thin skin and proportionally large body surface area. Newborns, infants, and young children are more likely to develop hypothermia because they have a larger surface area compared to weight or body weight, so they can lose body heat faster than older children and adults. You're crying? Get your baby? Nah, he good. He out there. First of all, he's grown. He almost 18 months, so he pretty much can watch himself. Y'all, I'm just playing. Please don't call nobody on me. He in there with adult supervision, okay? Don't be coming after me. Hypoxemia is more likely because of their high oxygen demand, right? Neonates, infants, and children are at an increased risk of hypoxemia because of smaller functional residual capacities, increased heart rate, and increased metabolic requirements compared to adults. And for G, liver and spleen injuries are more likely due to the thoracic cage of children given less protection. Okay. So I know that was a lot. I know that's so small. I can't help for the fact that it's this small. It's just kind of how it works out. But if you guys followed me and if you guys like me and stuff, I'd be able to put it on the computer. Okay. Here we go. Next one. All right. Number 10. All right. What is regarded as one of the priority actions that must be accomplished when a primary assessment of a trauma client is conveyed? All right. So what is the priority action? What do I want to do for somebody that's a trauma patient? So taking a full set of vital sign measurements, completing a brief neurological assessment, monitor pulse oximetry reading, or palpating and auscultating the abdomen. Mommy says B. Okay. All right. Thanks for the share, Lala. Appreciate the share. Appreciate the follow, y'all. Appreciate the love and the follow. Make sure you guys keep smashing that like button. Hey, let's get to like 50,000 likes, y'all. Let's get there. B train, baby. Like no A train. Okay, I got you. I never like A train. Not since the first 10 seconds of the boys. A train can just go ahead and A train that ass out the door. All right, I'm going to give you guys about another 30 seconds. Hey, these 30 seconds go by really fast, all right? So make sure you guys keep smashing that like button. We're going to keep it pushing. We're going to keep it pushing. Mommy says B. I saw that. I saw you put B. I saw you. Stephanie Marie says B. Roy, appreciate the share. Impressed with this. Thanks, Lala. I'm glad that you like this. I do it every Monday, Wednesday, Friday at 5:30 Texas time because that's the only time that matters. I'm just playing. All right, we got B. All right, 5 more seconds, y'all. 5 more seconds. A, to get a baseline. Okay. A. So nervous to take the nuclei. Nah. Don't be nervous. Here we go. So the answer is B. Let's find out why the answer is B. A brief neurological assessment to ascertain levels of consciousness and pupil reaction is part of the primary survey. Once the patient is stabilized, a neurological examination should be conducted. CT scan is the diagnostic modality of choice in the initial evaluation of a patient with head trauma. Keyword, trauma patient. Keyword, trauma patient. Look, hey, Michelle, I know you're saying, nah, I don't agree with that. And I know where your head is at, because where does it say anything about head up in here, right? Where does it say anything about head up in here? But it says, we're going to read this one again. What is regarded as one of the priority actions taken that must be accomplished when a primary assessment of a trauma client is conveyed? First of all, I don't even like the way that is even written. It's just like, hey, let me put all this extra shit up in here to confuse you, right? But the keyword is trauma, right? Because when a trauma patient comes in, yeah, we're going to get those full set of vitals, right? But you may not, here's the thing, is like, you may not agree with all these questions, and that's understandable. That's understandable. However, when you're giving questions, let's say on NCLEX, you go up to 150 questions, right? If you're giving questions and it's up to 150, let's just say that you're like, that one doesn't make sense. Or if you're practicing, that one doesn't make sense. If you get 100 questions, 5 of them are not going to make sense, but the other 95 will. Okay. But you do get vitals on everyone. I thought first. Okay. I'm tracking. But even though you see that they say priority, but it also gives you the background, or paints the background of it being a trauma patient, right? Trauma, I was thinking possible bleeding, right? Vitals can help us assess for internal bleeding. 100%. I don't disagree with y'all. Some of these questions are not the greatest, y'all. And even when it doesn't matter what program you buy, it doesn't matter where you're at in your program in school. If you're doing ATI, HESI, Kaplan, or if your school's doing internal, whatever that they do, some of these questions are not the greatest. Some of them are not the greatest, but the majority of them are they're good. They're good. We don't have to agree with them. We just got to push our way through them. But anyways, hey, shout out to all 234 of y'all that are in here. All right. Right now we are doing NCLEX questions. If you don't know what those are, these are practice questions for taking the licensing exam for an RN or an LPN or LVN. All right. So I know I got some pharm students in here, some med students that like to pop up in here and listen to me run my mouth. So I appreciate y'all coming up in here. So that's what we're doing. I'm Kevin. I go by the Boot Nurse on all social media platforms. Make sure you guys go over there and check them out. Instagram, Thread, X, DMX, RIP to him, right? So YouTube, of course. Hey, and if you guys if you know anybody that needs this, I post all these TikToks to my YouTube, and they're the same amount of time, 2 hours, 3 hours, whatever. So if they miss it and they want to get something like this, they can jump over there and they can check them out as well. Make sure you guys participate. Participation is the key. All right. I'm kind of, sort of, not really, but really kind of funny. So it all just depends. Did you take the no? I did not take the next gen. I actually did take a next gen quiz yesterday, and I got a 64%. I got a 64% on it, which told me I highly likely was to pass. And I was like, well, I would hope so. But then again, once you start working as a nurse, some of that stuff, out of sight, out of mind type stuff. So, but I actually did pretty well on it, and I was actually pretty happy with myself. But I feel like now I can't even mess up. Right. And I had next gen questions on there, and I like the next gen questions, y'all. You can get 6. You can get 6 out of a case scenario. And that's great. And the next year, you're like, how the hell did I get to this question? But anyways, make sure you guys.
I couldn't find scenario in your Apple Music library. You can ask me to play a radio station or ask for your music on a different app.
Y'all hear her? Did y'all hear her? I ain't saying nothing to her, and she always listening and eavesdrop. I'm about to unplug her. I don't even like that. Yo, Siri, we got to talk later though. All right. Anyways. Oh my God. Hey, but the more you like, the more questions that you get. Hey, but you do you. I know it's suspicious, right? That shit crazy. That scared the shit out of me. I'm not even gonna lie to you. But guess how many likes I want, y'all? All of them, not some of them, not a few of them. I want all of them. All right. Hey, we need 10,000. I need 10,000 followers so I can stream on the computer. Y'all are complaining about the fact that this is too small, or it's blurry, or it's this, or it's that. Well, if y'all want me to do this off of this, I need for y'all to follow me so I can do this on this for y'all. This for y'all. All right. So there's that. I created an NCLEX course, the 7-day NCLEX course. It's in its pre-launch phase. The reason why I created it is because I failed my NCLEX 3 times. Three times. 1, 2, 3. Took it on the 4th, passed it on the 4th. I passed in 2020, right? So I never want anybody to feel like I failed. I felt like a failure. I felt like I wasn't good enough to be a nurse. I felt like everything that you could possibly think of when you fail anything. So that's why I tell people, like, yo, this test doesn't define who you are. You define who you are when you work as a nurse. Either you're going to be a good nurse or a bad nurse, but your test doesn't determine that. The tests determine if you can have the basics of the basics for nurse safety. That's what it means. Okay. It doesn't matter if you're an RN or an LPN, right? Because you're not saying that you take the same exam. However, they're relatively the same. The only thing that's different about what you can and can't do. Okay. So I created that course for $48. You get it forever. We're building it up right now. We're building the plane from Spirit and Frontier to Emirates Airlines. You know what I'm saying? We're trying to get those $10,000 like first class seats, baby. That's what we talking about doing. You see what I'm saying? And that's another thing. I'll always be transparent. Like, I have no problem letting y'all know what's up, because I mean, what would me lying to you about that? Like, what is that going to accomplish? It's not going to accomplish anything, right? So that's why I created it. I created it for my people, LPNs, RNs that are taking this exam, right? From point A to point B with all that fluffy shit out the way. Anyways, so check that link out. It's in my bio, along with other stuff that's in there. So my YouTubes, my Facebooks, all that good stuff. All right. So check that out. Hey, don't troll my chat, right? Don't troll my chat. Don't come up in here saying stupid shit and act a fool. You troll my chat, I'm going to troll you, right? If you troll my chat, I'm going to troll you. Then I'm going to give you a 600. What is a 600? Well, a 600 equals 600 seconds, which also equals 10 minutes. And that's how long I'm going to ban you. So if you come into my chat acting a fool and you start talking stupid shit, I'm going to ban you. And not only will I ban you, Nurse Nelly will ban you, or whatever other my moderators will also ban you. All right. And also, I like to do a democracy. So sometimes I'll ask chat. I'm like, chat, what do y'all want to do? As soon as you tell me 600, bet. We're going to make it happen. All right. Because we're trying to foster a great environment. And that's all it's about. All right. And I also don't gatekeep. I got these questions from nurseslabs.com. So if you're a new nurse and you're a nursing student and you're trying to learn all these different things, and especially like in fundamentals where you're trying to learn about like your nursing diagnosis and all that good jazz, go check that out. Hey, Breezy. Hey, if you don't like the time, go away. There you go. All right. I haven't taken my test yet, but this is really helpful. I'm glad this is really helpful. All right. So without further ado, we'll go on to the next question. But here's something I want from you guys as well. I want to know who you are, where you're from, where you're at in your nursing journey. Are you a brand new nurse? Are you a nursing student? Are you in your prereqs? Like, we want to know. Let us know what's up. All right. So here's our next question. Prior to oral defense, a 21-year-old nursing student goes straight to the clinic due to a tingling sensation, palpitations, and chest tightness. Deep, rapid breathing and carpal spasms are also observed. What is the nurse's priority action for this situation? Do we want to give O2, allow the student to breathe into a paper bag, report to the physician immediately, or get an order for, anxiety medications? Why does it say that, bro? I don't even like the way that says that. Anyways, so yeah, what are we thinking? And as you guys are trying to answer, I'm going to see where you guys are at. Lord of mercy. 23 BSN last semester. Shout out to you. I'm a teacher. Was that Kyle? Killer Kyle's Lemonade. Shout out to you for being a teacher, student. Do you know if there is a step session like this? Ashley, I'm not sure. Ashley, wait, you've been in here before, but I don't know if there's a step session. Ashley, you know what you should do though? You should actually do one. You should do lives with step. And the best way for you to learn is to teach others while you learn. I promise you, it's like it'll absorb so much faster. Some from Boston in last semester. Shout out to you, retired LPN. Shout out to you, Michelle. About to apply for nursing school. I'm in Indiana. Ball State. I know some folks that live over there. In Muncie. I'm a junior in high school taking my prereqs for nursing school. Shout out to you, Brooklyn. I'm a volunteer at my local hospital going to nursing school in 25. Shout out to you. My name is Tucci. Graduated in May, trying to write in my NCLEX. Shout out to you, ma'am. Shout out to you. A. I'm a PA just here for fun. Hey, you don't have to be here for fun, but I appreciate you being here for fun. Just answering all the questions. I appreciate it. I'm in VT graduate, Virginia Tech. Nice. Oxygen. Okay. I see you. I'm going to give you guys about another 30 seconds. All right. I have heard about the bag breathing when someone is hyperventilating, right? Mm-hmm. Just graduated from nursing school, waiting to take my NCLEX. Shout out to you, Catherine. White Coat ceremony next month. Shout out to you, Sam. Shout out to y'all. All right. 10 more seconds. Here we go. In 3, 2. All right. So the answer is B. Allow the student to breathe into a paper bag. A student is hyperventilating secondary to anxiety, and breathing into a paper bag will provide rebreathing of or recirculating of carbon dioxide, right? Encouraging slow breathing will also help. The idea behind breathing into a paper bag or mask is that rebreathing exhaled air helps the body put CO2 back into the blood. Yes. Gabriella, yes. Yes, Lord. There it is. Hey, shout out to the follow. Appreciate it. Is it Riley? Thank you for the follow. Good luck, everyone. Y'all got this hard work. It'll pay off. Facts. And here's another thing, too. I don't know. I've only gone through a couple of, nurselabs.com stuff in regards to the next gen. So I personally haven't seen anything. But in reality, what this will do, these type of questions have not gone away. They're still there. Okay. What is this? Lulu, we're doing NCLEX questions. Am I in the United States or in Canada? User 51. I'm in the United States. What do you think about NCLEX Bootcamp? I think, have I seen them? I think I've seen them one time. The website. I may have seen it like when I Google searched it, but I never like clicked on the website. So I really can't speak on it. All right, here we go. Question number 12. The nurse is assigned to a small rural community hospital. 6 clients have arrived to the emergency department because the local church was caught on fire. More affected residents are expected to arrive soon, and it's the only hospital nearby. So now we're going to arrange them, right? So arrange the following 6 clients in the order in which they should obtain medical attention utilizing disaster triage principle. So critical to least critical. All right. To me, NCLEX Bootcamp was the best for RN. All right. Well, shout out to you. I personally have never seen them. I mean, I have seen them like when I searched on on Google, but like I said, I never used them. I like Mark Klimick and I like Kaplan. Those are the 2 that helped me out a ton. So, and of course they have other ones like, Archer, UWorld, Remar Nursing. Shout out to Regina. If you're doing LPN stuff, you got the nurse Sam. She has her stuff as well. Picmonic. There's a ton of stuff that's out there. So, hey, we're going to put them in order. We're putting them in order. So what are we doing? Lalo says B. Says F, B. F goes first. Okay. All right. What are we doing? F goes first. Okay. All right. So, hey, we're putting these in order. Give you guys about another 30 seconds. Don't shy from it now, y'all. Don't shy. You'll have questions like this where they'll tell you to put them in order. A is first. A 50-year-old man with full cardiac arrest who has been receiving CPR continuously for the past 30 minutes. A, F. Okay. All right. A or F. A is dead. Okay. All right. All right. Let's see what the answers are. Here we go. So it's C, E, B, D, F, and A. And obviously this is really small, and I know that you guys can't see it, right? So let's go back. I'm going to go back. So C, it says the 11-year-old wheezing and heavily labored breathing unrelieved by asthma, right? So now he is in an acute stage of having like an acute asthma attack, right? You put it backwards, Ray. It's all good. This is why we're learning it, right? And then E was a firefighter who exhibits combative behavior with a respiratory stridor. So what does stridor mean for somebody if they have it? Is that an upper or a lower airway issue? Okay. So, and it says B, a 19-year-old anxious girl with a crushed leg that is very swollen and she has tachycardia, right? That's an upper airway. So that's telling me if I have a firefighter who has an upper airway obstruction, 9 times out of 10, he's a firefighter. So he probably has a burn, an upper airway burn, right? Yes, stridor is upper airway. So he has an upper airway burn, right? And if he has a burn to his upper airway, what do you think and know is going to happen? Eventually. Doesn't make sense. Are you going to stop? You're just going to stop CPR? So here's the thing. If I'm doing CPR on somebody for 30 minutes, continuous, and if they don't show any signs, what does that tell you? And remember, this is a triage. This is a disaster triage, right? This is a disaster triage. So I'm going to go to the most critical people that I know I can save versus if you have somebody who I'm doing CPR on, and I already know that they're dead. 30 minutes CPR. That's a long time. Yeah, he's dead. There you go. Critical first. And the most critical one would be our guy who is definitely having heavy labored breathing, unrelieved by his wheezing and his heavy breathing, right? Now, I know people can argue with the firefighter, but he's combative and he has respiratory stridor. He's still breathing, but he's going next. He's definitely going next. Anybody that has a burn to the face, they're getting intubated for sure. They say, why would the BB that seems to be at least number 2? Respiratory distress burns over 70% of anterior. Let's see. Whoops. And so F, it says, giving comfort measures to the children with a burn. more than 70% of the anterior. However, the prognosis is very poor in certain patients who are too unstable to move from their primary survey, are unable to be resuscitated and stabilized, and secondary survey should not be performed. Right? So airway, yeah, ED is wild. The ED is wild. And here's the thing, you have a patient who's burned over 70% of their body, of the anterior, like that. Yeah, that's a big problem. The chances of you trying to do anything for them are going to be really low. So you're going to take care of people that you know that you have a higher chance of survival before you go over to somebody else. But yes, always airway. All right, so here's question number 13. Identify the 5 most important elements in conducting disaster triage for multiple victims. So we're going to select all that apply. Are we going to assess a level of consciousness, check airway, breathing, circulation, monitor vital signs, including pulse and respiration, inquire about last tetanus shot, determine history of allergies to food or medicine, know the list of their current medications, give or identify past medical and surgical history, note color, presence of moisture and temperature on the skin, visually examine for gross deformities, bleeding and obvious injuries. So now select all that apply. So which ones? So pretty much saying that there's no hope for the child in that situation. Yes. Is that Cheyenne? That's exactly what I'm saying. Jessica, Jess the Mess is here, y'all. Shout out to Jess the Mess. What's up? What's up, Heather? How are y'all? Welcome. We are on question 13 of I don't know how many. So, yeah, there's that. What is that? ABCI. Okay. ABCI, ABCHI. Okay. ABCGI. Kendall says ABCI. CC says ABHI. C. Okay. ABCEI. Okay. Michelle says ABCFI. Okay. All right. I'll give you guys about another 15 seconds. ABCHI. Shout out to the male nurses and male nursing students. Hey, shout out to y'all. Shout out to all the male nursing students. And shout out to me because I'm a male nurse. So I guess I fit into that category. Appreciate that. All right. Here we go. Here's your answers, guys. In 3, 2. So it is A, B, C, H, I. Nah, I'm Tyler. I'm picking up what you're putting down, bro. I got you. All right. A, B, C, H, I. So A rapid assessment of a patient's neurological status is necessary on arrival in the emergency department. This should include the patient's conscious state and neurological signs. This is assessed by the Glasgow Coma Scale, pupil size, reaction, and what does it say? Lateralizing signs. B, the common acronym for primary trauma is ABCDE. So airway, breathing, circulation, deformities, exposed. Because if you guys never heard the term, shit happens when you're trauma naked. I'm just saying you got to expose them. Okay. And then for C, it says we always do a set of vital signs. Right? We want to know what that heart's doing. We want to know what that blood pressure's looking like. We want to know where they're bleeding from, if they're bleeding from anywhere, right? Checking exit wounds, in case they got shot or whatever the hell, all that stuff. H, in this, it says all possible skin areas. So we always want to check for, lacerations, deformities, abrasions, hematoma, ecchymosis, marks, bruises, all that good stuff, burns, so on and so forth. The extremities in regards to I, we want to check for, those bone fractures or any tenderness or crepitus in the extremities, all that good stuff. Okay. So shout out to everybody that got the answers. All right. And now let's roll on to the next one. Shout out to all 91 of y'all that are in here rocking with me and the rest of the crew. Hey, if you're a new nurse, I want to know who you are, where you're from, and where you're at in your nursing journey. Let us know. All right. Question number 14. A group of passengers enter the ED with complaints of cough, tightness in the throat, and extreme periorbital swelling. There is a strong odor coming from their clothes. They report exposure to a gas bomb that was placed on a bus terminal. What is the priority action? Rapidly transport or transfer clients and visitors to the ER, from the area. Check vital signs and auscultate lung sounds. Assist clients to the decontamination area, or direct clients to a cold and clean zone for immediate treatment. Jess the Mess says C. Ray says B. Okay. All right. All right, we got B. All right, so this will be what, like a bioterrorism type of attack, right? So now it's just like, okay, what is the very first thing that we do? Remember, you got these patients that are showing up to the emergency department. They're coughing, got chest tightening in the throat. Their eyes are all swelling, right? They have a strong odor coming from their clothes. And they told you that there was a bomb that went off, but they're in your ER. They're in your emergency room. They are in your emergency room where there are other sick patients. Remember, they just walked into your emergency room. So what is the very first thing that I want to do? Stain gal. What's up, girl? That's what I'm talking. Hey, you back here, and that's what I love to see. You're back here, and that's what I love to see. We got AAC. We're kind of all over the place, right? So remember, this is like a bioterrorism, like mass casualty type of issue. Hey, like I said, I love the fact that you're here because you're going to keep pushing. I have to pass NCLEX. Don't tell me that you have to. Tell me you will. To prevent anyone else from hazardous vapors. Yep. I like where your head's at. Heather says A. Okay. All right. I'm going to give you guys about another 15 seconds. Thank you for the follow, Julie. It says gas bomb. Exactly. It does say gas bomb. So if there's a gas bomb, and they were exposed to being gassed, and they're coming into your your emergency room. I have no idea what that is. Right? So here we go in 3, 2, 1. All right. Assist clients in the decontamination area, right? Decontamination is in a specific area is priority because we don't know what the contents of that is. Right? We have no idea. So if there's any type of bioterrorism or biohazard type of attack, you have to do all of the assessments outside of the hospital to decontaminate the patient before you take them into the hospital. Must get contaminated off, and then exactly. Right? Because we have no idea what the rest of that's going to do, right? It says the decontamination and support area are established within the warm zone, also referred to as a contamination reduction zone. Decontamination involves thorough washing to remove contaminants. I used to be part of a decontamination team when I was in the Navy, and this is exactly what we had to do. So if we got bombed or do whatever, or if there's gas, that's exactly what you have to do. You have to triage them outside, clean them off, all that good stuff, and then they get more definitive care in a harder structure where the doctors and everybody else is at. Okay. Shout out to y'all. Thanks for the rose. Thanks for the follows. Appreciate you guys. Maria, I appreciate. Thank you for your service. Oh, thank you for your support. I appreciate that. So shout out to y'all. We'll go on to the next question. I think that one's pretty self-explanatory, but I know that some of those can they can definitely be confusing. All right, here we go. All right, so question number 15. You always hear me say paint the picture, right? Paint the picture for yourself. A drunk driver has been in the police station for 48 hours. During the first hour, he had tremors and was feeling anxious and sweating. Currently, he is experiencing disorientation, hallucination, and hyperactivity. It was noted that the client has a history of alcohol abuse. What is the priority nursing diagnosis? All right. What's my NANDA? Right? Is it risk for nutritional deficit related to chronic alcohol abuse? Is it risk for injury related to seizures? Risk to situational low self-esteem related to police custody? Or is it risk for other directed violence related to hallucinations? We say B. B. Go Bayside. Heather says B. Okay. Shout out to all y'all. Shout out to all 100 of y'all hanging out in here, rocking with me. We're doing NCLEX questions, nursing style questions for those that are in nursing school or studying for their licensing exam. So y'all participate. The more you like, the more you share, the more questions that you get, because that's how we roll around here. Amber says B. Thanks for the follow. Is it Khadijah? Thank you for the follow. I hope I said it right. So, all right, I'm going to give you guys another 15 seconds. Lauren says B. Okay. All right. Like Khadijah from like Living Single. All right, cool. 'Cause you're living single. Alexa says B. All right, cool. All right, here we go. Here's our answer in 3, 2. So the answer is B. Risk for injury related to seizures. Client safety is a priority because the driver exhibits neurological hyperactivity and is on the verge of having a seizure. Medications such as Librium are needed to decrease neurological irritability, and phenytoin or Dilantin for seizures. Thiamine and Haldol may also be ordered to treat other problems. Look, I used to work in the ICU, and we used to have people come in for alcohol withdrawals. And then, hey, so here's the thing. What can you get after alcohol withdrawals? This is just a generalized question for y'all. What can alcohol withdrawals go into? Because remember, you'll have people that'll go from alcohol withdrawal into this next thing. And then there you go, delirium tremens. Hey, did you guys know that there's an alcohol, like a Belgian beer called delirium tremens? Now you do. Anyways, so I've had patients that have been in delirium tremens, right? And start hallucinating, seizures, you name it. Haldol, fantastic. Thiamine, fantastic. Ativan, fantastic. It's great. It is messed up. I'm not even gonna lie. Oh, you didn't know that, Lauren? That does not give you the graces for you to go get that. Thank you. This is super helpful. Is it Emily? I'm glad that you think this is helpful. Share it. Tell everybody. Make sure you guys smash that like button. The more likes, the more you guys share. All that good stuff. Doctor order. What are you talking about, doctor order? What you mean? Of course, it'll be under a doctor's orders. Yes. Haha, doesn't sound appetizing. I'm telling you, you have one. It's like 9% alcohol. It's bad. I may have had about 4 of them one time. And yeah, we just not. Some people will get a lot of it. So, look, let me tell you something about that Ativan. Let me tell you guys about a CWA. So essentially, alcohol patients that are on alcohol withdrawals, they get, what we call a CWA. So what that does, it tells us like their level of hallucination and how much medication we need to give them. I've seen some dudes who are withdrawing and they come up with a scale of 22, and it'll tell you how much Haldol or how much Ativan you need to give them. So essentially, it helps kind of break the neurological issue that they're having. So nurse's diagnosis. Oh yeah, I'm tracking. I got you. All right. Oh, we're at a break. Hey, I don't even know why these things are going so fast, but I appreciate everybody that is rocking with me. Hey, if you guys are new here, we are doing NCLEX questions. Shout out to everybody. Make sure you guys follow. Tell a friend. Tell a friend to tell a friend. My name is Kevin. I go by the Boot Nurse on all social media platforms. Make sure you guys check me out. We're doing questions right now. Hey, participation. I want you to participate. Hi, JC. How are you? Hey, make sure you guys participate. The more that you participate, hey, the more, funnier or not funnier I'll be. The more likes that you give, or the gifts or whatever, the more questions that you get. But whatever, what do I know? You do you. I want all the likes, all of them, not some of them, all of them. Sabrina said, I will pass NCLEX. That's what I'm talking about. That's what I'm talking about. Do you ever do practice on hemodynamics? We haven't gotten to hemodynamics yet. However, we do get requests on things, So, what does it say? How this is avoided or treated in a high-risk patient who quit alcohol. I might have missed it. I don't even understand how you just asked that question. I'm confused on your question on how you asked it. Yeah, so I want all the likes. I want all the likes. I want all the likes. I want all the shares. Make sure you guys share. Appreciate you. I need 10,000 followers so I can stream off the computer. So that way y'all can see it. And this isn't ghetto. You know what I'm saying? Sometimes my screen is all like all grimy because I got mudgy fingers. This is all like pixelated. Sometimes the chat down here covers up so I ain't trying to do all that. You know what I'm saying? I'm trying to be better out here. So shout out to y'all. Make sure you guys follow. All right. So we don't be ghetto. Also, 7-day NCLEX course. Make sure you guys check it out. It is in the link in my bio. It's an NCLEX course that I created because I always thought to myself that I was a failure. So what I did is I started teaching people how to pass the NCLEX because I failed the NCLEX 3 times. If you're new here, I failed the NCLEX 3 times, and I have no shame in telling anybody that at all whatsoever. So, this is my testimony to y'all that no one's ever going to ask you how many times you're taking your test. No one's going to care. No one is going to care how many times you're taking your exam. The only thing that you need to do is focus and pass that damn exam. Trust me when I tell you that exam does not discriminate. And you are bigger than that. I promise you. I promise you. I promise you. Okay. So get it down, get the practicing. The more that you practice, the more that you get out of that anxiety. I'm trying to take away all of the fluff that's, outside of here and get you to point A to point B. Okay. That way you don't have any of this nonsense that's just distracting you. Okay. That's why I created the 7-day NCLEX course. That link is in the bio, $48. Once you get it forever. You get all the updates. We're at Spirit and Frontier getting to Emirates Airlines. You feel me? All right. That's what we're doing. Hey, don't troll my chat. Don't come into my chat acting a fool. If you do, you're getting a 600. A 600 means that we're banning you. And it means 600 seconds, aka 10 minutes. And at 10 minutes, we ban you. Or we ban you for 10 minutes, but we're going to ban you forever. So, and also, if I don't see it, and if somebody's coming in here acting a fool, Nurse Nelly, who is my co-host, will also ban you. And if I don't see it, hey, there's a democracy in here sometimes when I feel like it. And you guys can also let me know and we can give somebody a 600. Because we're trying to foster a good environment. I don't need people coming in here telling me, hey, just study and do this. It's not for me. This is for y'all. All right. That's what we're trying to do, trying to make y'all feel better about conquering and achieving this goal and through your journey. OK, so somebody said, is this on YouTube? It is on YouTube. So if you go to the Boot Nurse on YouTube, you will see a whole bunch of TikToks that I put on there. All right. Thank you. I appreciate you, ma'am. You are very welcome. And also, I don't gatekeep. I got these questions off nurseslabs.com. They are NCLEX questions that they have created and they're free. They're free along with a whole bunch of other stuff that's over there. So I would recommend going over there, at least checking it out. Shay says, when does it start? When does what start, Shay? What do you mean? I take my NCLEX on the 21st. Okay, thank you so much. How often do you do these? Every Monday? I do them Monday, Wednesday, Friday at 5:30. Can we do electrolytes? Got a test on Wednesday, mostly on that. We can try. We can try to do electrolytes. We'll see. I've had plenty of requests for a bunch of stuff, so we can see what's up. All right. Make sure you guys smash that like button. Make sure you guys follow because, hey, the more people I get to follow, hey, get off TikTok. Oh, yeah. Get off TikTok. You're supposed to be studying. Got them. All right. Here we go. Question number 16. During a class discussion, a 50-year-old professor suddenly feels left-sided chest pain, dizziness, and diaphoresis. What is the priority action when he arrives to the emergency or the ED triage area? We give him O2 via nasal cannula, start an IV, notify the emergency or notify the physician, or set him on a continuous EKG. D. Somebody said A. Who said A? Kirsten said A. Can't see the question all the way. Oh, man. Here, let's see. Is that better? Always got to rule out STEMI first. Okay. All right. Rule that STEMI out. Is that better? Let me know if that's better. Hold on. Lord of mercy. Better? Okay, cool. So we got C, D, A. I feel like oxygen airway is always first, but it's what we were taught, but it's always tripped me out. So G, let's look at this question. So look at what's presented to you, right? This is what's presented to you. A 50-year-old professor suddenly feels left-sided chest pain, dizziness, and diaphoresis. So he's sweating a lot. What is a priority? So now this is where studying content and understanding your pathophysiology, right? It's like, hey, what is this telling me? What is he displaying? Right? I'm going to give you guys about another 20 seconds. All right. So what is it displaying? This is why I'm a content guy. Like, I'm not going to sit here and try to show you tricks and, things. I mean, I'll show you things that you need to know, but I am not going to be one of those people that is just going to be like, yes, it's going to show like possible MI, heart attack, right? So what is the thing that I want to think of? What's the very first thing? As soon as I get to the emergency department, they're like, oh, my chest hurts. I'm dizzy. And you visibly can see that they are sweating, right? Trust me, all of these things are going to happen. But which one's going to happen first? Right? Remember, systematically, 1, 2, 3, 4. What is the very first thing that I need to do? Nelly says EKG. Rhythm. Okay. Oxygen takes priority. Okay, Abigail. Airway first, airway. Okay. All right. A, we got A, oxygen. All right, 5 seconds. Here we go. 3, 2, let's see what the answer is. Yeah, look at that. So we want to supply oxygen via nasal cannula, right? So, go back. There we go. So here we go. Increasing myocardial oxygenation is the priority goal, right? Increasing The oxygenation is the priority goal. I was about to say, well, look, I'm just saying, look, I don't write the questions. I'm just saying, I take an NCLEX tomorrow advice. My advice for you. All right. I'm pausing right now. Y'all can read these questions, but somebody just caught my attention. Alicia said, I'm taking my NCLEX tomorrow. What is your advice? So my advice to you is to get off this live stream and go relax. Get off. Go relax. If you haven't, put it this way. I know that you've been studying. NCLEX tomorrow, go eat, go to sleep, go away, go home. Go relax, go take your exam. All right. Because here's the thing I'm going to tell you is that one of my instructors used to tell me, if you try to cram or do anything or look at anything, you obviously don't think that you're ready. But if you don't know it by now, you don't know it at all. Okay. So, hey, Shay, I'm not talking to you. Relax. So, that is for Alicia. You need to go home. I know you at home, but you need to freaking go relax. Okay. What is the rationale for A? I don't get it. It says increasing myocardial oxygenation is a priority. Place the client on a cardiac monitor, establish an IV, then give those meds, blah, 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 control pain, and consider oxygenation. So it's oxygenation first. But the second option was EKG. So the cardiac monitor. I'll come back and I'll let y'all know. Yes, today is what? Today's Monday. You come back on Wednesday and let us know. Okay. What was the question? The question we were talking about somebody who has an MI. All right. You got this though. Come back and let us know what's up. All right. We're going to the next question. All right. Question number 17. A child with a fever has been admitted to the emergency department for several hours. Cooling measures are ordered by the physician in order for the client's temperature to come down. Which task would be appropriate to delegate to the nursing assistant? Is it A, prepare and administer a tepid bath? Is it assist the child in removing outer garments? Educate the need for given cool fluids? Or tell the parents to use acetaminophen instead of aspirin? We got B's. I mean, you guys are answering. I'm trying to get to it. I got the question wrong. I'm upset. Don't be mean to me. Wow. Shay, you're good. Girl, you good. You good out here. You got the question wrong. I got you. Rationales. I got you. Hey, so like I said, some of these you're not going to like. Like, you're just not going to like them. You're not going to like the question. You're not going to like the answers and the rationale. Remember, this is perfect world. This is a perfect world scenario. B, then A. Okay. So I'm assuming, Michelle, you're saying B. Okay. GR says, B, RN is supposed to teach, right? Right. The STEMI question was a good one. Yep. It was a good one. All right. I'm going to give you guys about another 20 seconds. 20 seconds to answer this question. Who says? Aaron says B. Says Meek says B. Is it Apana? Apana says A. All right. 10 seconds left. Let's see what you got. Glenn says B. Hallie says B. Not the tepid bath because, okay, I got you. Not the tepid bath. Tracking. Here we go. Answer in 3, 2. So the answer is B. Assist the child in removing outer garments. The nursing assistant can assist with the elimination of outer garments, which enables the heat to dissipate from the child's skin. The nurse who delegates aspects of care to other members of the nursing team must balance the needs of the client with the ability of those to which the nurse is delegating tasks and aspects of care, among other things such as the scope of practice and the policies and procedures within the particular healthcare facility. Right? A, if admitted, but patient. Hey, there is no if. We don't say no if. You will literally, don't do that. Don't do that. Don't say no if about nothing. You take them at face value. You take them at face value. All right. And if they are admitted, yeah, but that doesn't say nothing about them being admitted at all. It's because once you start doing anything like that, saying like a whole bunch of what ifs or whatever, you'll start to change your answer. You'll start to doubt yourself, and then a whole mess of things is going to happen. I always do that and make a story too. Look, you better stop making stories. Yes, don't read in. Just the mess said, don't read into the question. Do not do it. Appreciate the follow. Shout out to everybody that's in here, all 150 y'all. Make sure you guys smash that like button. Right? Make sure you guys share. Hey, I need like 50,000 likes, y'all. 50. I think that's the most I've had. So I'm trying to get back to that. But y'all ain't trying to let me be great. You know, because apparently y'all don't like me. But whatever, you know what I'm saying. Anyways, here we go. Question 18. A traveler's feet suddenly become pale, turn red, and feel very cold. In just 30 minutes, the affected part becomes prickly and numb. Place the following interventions in the correct order for a client with frostbite. So what is the first thing that we want to do all the way to the last thing that we want to do? All right. Meek. Every time I see your name, I just want to start singing Meek Mill. I don't know why. I mean, I do know why. Reading into the question gets it wrong most of the time. You are 100% right. I always say RTFQ. If you've been here long enough, what does RTFQ mean? Jess the mess. Tell them what RTFQ means. Nakima Rodriguez says B. But hey, we're putting it in order though. B first. Okay, tracking. So yeah, B says remove the client from a cold environment. Okay. What else we got? Shout out to all 215 of y'all. Make sure you guys make sure you guys share. We're doing nursing style questions for nursing students and nursing graduates getting ready for NCLEX. Trying to get those gears turning up in that brain. So make sure you guys smash that like button. Make sure you guys share. Shout out to y'all. BEDAC. I must not have been here long enough. Jess. Oh my God. Fired. You're fired. All right. No, RTFQ. Who can tell me what RTFQ means? Autumn says BADCE. RTFQ. Read the explicit word question. Yes, thank you. There you go. There you go. I don't like saying free. There you go. Read the F question. Gotcha. Shout out to you, Lauren. Lauren knows what the deal is. She knows what the deal is. All right, here we go. I'm gonna give you guys about another 15 seconds. Another 15 seconds. All right. Shout out. Is it Nadar? Nadar. Appreciate the follow. Thank you. All right, here we go. And 3, 2, 1. Hey, so it's BADEC. That, ladies and gentlemen, is the answer. So first one is that we want to get the patient out of a cold environment, right? We don't want to keep exposing them to those areas, right? The next thing is NSAIDs. So ibuprofens are indicated to control pain and prevent further inflammation, right? But if we have stronger medications, we can give those to them as well. The care of the patient with frostbite begins with rewarming in the field if there is no anticipation of refreezing, right? So you want to, and then once you get into a hospital, warm water, blankets, what else? Patients with systemic hypothermia should be managed by raising the core temperature above 35 degrees Celsius, warm IV fluids, so on and so forth. Apply loose, bulky dressing to prevent infection, right? And then you want to look out for those signs of compartment syndrome because the patient's extremities are going to be swelling because, those swollen extremities can turn into a tourniquet, right? So think about that. Warm fluids, always pre-medicate for wound care. Yup. I used to work in a burn ICU and everybody in the burn ICU got baths almost every day, right? Everybody got a bath, right? Because they're susceptible to damn near everything, especially like fungal infections. Yeah. So you definitely want to, you definitely want to take care of that. Feeling #smart. You are smart. What you talking about? That's what I'm saying. That's why we do this. Oh, that's why we're all here. All right. We're going to the next question. Question number 19. An elderly maintenance staff is lying on the floor in the emergency. Sorry, y'all. I'm distracted by my son screaming out there because, he's crazy. But an elderly maintenance staff is lying on the floor and the ED nurse responds to the call for help. Lists the order in which the nurse must carry out the following actions. So we're going to put them in order. I made it to the live, Kevin. Shout out to you, Joanna, for making it to the live. I'm getting them all wrong. Catherine, it's okay if you get them all wrong. This is why when you practice, you always read the rationales to why they are correct, but then you go to the answers and see why those rationales make those answers incorrect. You don't always have to agree with them. Okay? You don't always have to agree with them, but that is what I tell people when you read and you review your questions, all of them, even if you got them right. You need to know why you got it right, but then you also need to know the ones why you got them wrong. Okay. So what are we thinking? I need answers. I'm gonna give you guys a little bit of time, but I need answers. I took my first fundamental test and I feel confident. Shout out to you, Bella. Shout out to you. Keep that confidence. EABCD question mark. Ma'am, there are no question marks. There's not even 2 question marks. Avery, you're late. It's okay. Avery, you already know where to find them. You already know where I'm going to put them. So if you really want them, just go to YouTube. You already know the deal. And I'm going to put them up there. Or maybe or maybe A and B switched. Okay. Ashley says E. Autumn says, okay, I see you. Make sure you guys keep sharing. Make sure you guys keep smashing that like button. If you guys are here, we're doing nursing style questions for nursing students and nursing graduates who are taking their licensing exam. Make sure you guys hit that like button. Make sure you guys share. Make sure you guys follow. I need 10,000 people so I can stream off my computer and not be ghetto. You know what I'm saying? People don't want me to be great out here. My God, what's wrong with y'all? All right, here we go. I'm going to give you guys about another 15 seconds. Another 15 seconds. EBADC. Okay. Stacy says BE. Okay, it went away. It went too fast. All right, G, I got you. I see you. Here we go. Here we go. In 3, 2. So we got E. What the hell? Let me see. I'm turning it up just a little bit. Oh, that's better. That's better. So we got EBDCA. First establish unresponsiveness. They're unresponsive, right? Code blue. Anybody who's ever been in a code blue knows exactly. Everybody who's ever done a code blue, you guys already know what the deal is. All right. Hey, they're unresponsive. So we got to start doing some stuff off. We got to start doing some stuff for them. Okay. Appreciate the follow, Madison. Number 2, you want to get help and activate a code team. If you're in a hospital, you have a code team. Remember, on the NCLEX, you have everyone and everything that you could ever need. Okay. It's funny because in real life in the ED, we don't do this. You're right. Because we're not, ma'am, you of all people know what the deal is. You know what real life is. Don't do that. Don't be coming up in here confusing folks. Don't be coming up in here doing that. Amelia, appreciate the follow. 3, you want to open the airway. You want to do the head tilt chin lift or the jaw thrust maneuver. So like if you see an unwitnessed fall, you better do the jaw thrust, right? Because you don't know what type of head injury or neck injury that they have. You are on the code team in the ER. You are the code team. That's what I'm saying. In the ICU, you're the rapid response team, by the way, for people that don't know that, right? NCLEX is perfect hospital, perfect world, perfect patient. Facts. Number 4, you want to do CPR. Then number 5, you want to grab the crash cart, right? Especially if you're by yourself. These are the orders. All right, here we go. Question number 20. Which task is most appropriate to assign to the nursing assistant when an instantaneous death transpires in the emergency department? Is it A, assisting with postmortem care, B, escorting the family to the place of privacy, C, going with the organ donor specialist to talk with the family, or D, helping the family to collect belongings? Says A. Nat says D. Got Rose says A. Okay. Rustic Valley Farm. Is that like milk? You know what? It don't even matter. You say A. 100% A. Who said 100% A? Who said that? Keaton said 100% A. Keaton, you sure about that? You gonna die on that hill? I'm stuck between A or D. Okay. You gotta pick one, Autumn. You gotta pick one. Regardless, the answer is on the next slide. I'll die on that hill. My man, that's what I'm talking about. All right. You beat me to it. What do you mean? What? You sure about that? We have chickens and dogs and goats. Oh, okay. All right, cool. That's what I'm talking about. Got the goats, got the chickens, got the farmland. That's what I'm talking about. Shout out to you. All right, I'm gonna give y'all about another 10 seconds to answer this question. A all day. All right, Sam. Hey, we got 2 people that are solidified with A. All right, you already know. Sure about that? You sure? You sure about that? All right, here we go. Oh. And the answer is A. So shout out to y'all who picked postmortem care demands some turning, cleaning, lifting, and also on the nursing assistant is equipped and authorized to assist with these responsibilities. The use of it's a UAP, increasingly demands registered nurses to delegate patient care tasks. Sorry, y'all, this is really small even for me to read. According to the principles of ANA. These principles define nursing delegation as the transfer of responsibilities for the performance of an activity for one individual to another while retaining accountability for the outcome. Because, of course, the RN is responsible for everyone and everything, but I can delegate the responsibility if it's within your scope of practice. But if you fuck up, you in trouble and I'm in trouble. And I ain't trying to get in trouble for nobody. So make sure y'all smash that like button and y'all share because I ain't trying to get in trouble for nobody. All right, cool. Now let's see what you guys are saying. I just had to do this today. What you mean? What you mean? You had to do what? Come in here and start messing up? Hey, we don't switch our answers around here. Okay? We don't switch our answers. As somebody who has taken care of dying patients, I can tell you that this is very much a thing that a CNA or a UAP can do. She does not. My fault. What you mean? I just had to do. Oh, okay. All right. Cool. Shout out to all 140 y'all up in here. Let's see what's going on. Hey, so we're at a break. So shout out to all 123 of y'all in here rocking with me. If y'all are new here, my name is Kevin. We're going over NCLEX style questions or NCLEX questions. I found them off nurseslab.com because I don't gatekeep. If you want to know or go look at them, you guys can go there yourself and check them out. Okay. So make sure you guys participate. Kind of, sort of, not really, but really funny. Sometimes, maybe. Sammy, what is the deal? How are you? The more you like, the more gifts you give me or whatever, then the more questions that you get. So you do you. I want all the likes, all of them, not some of them, not a few of them, not a little bit of them, but all of them. All right, cool. As long as we tracking. I need 10,000 followers, y'all. I need 10,000 followers so I can stream from the computer so I don't have to look ghetto. You know what I'm saying? Because I can't see the question. It's too blurry. Why is your hand there? Move it. Can you go to the next question? That's what I hear, y'all. You know what I'm saying? And I would rather be on this nice, deliciously crisp screen of a computer. That way, we can get our questions on and popping. You know what I mean? So let's stop being ghetto and let's get up to 10,000 followers. All right. I always talk about my 7-day NCLEX course. If you guys don't know what that is, the link is in my bio. I created an NCLEX course because I failed my NCLEX 3 times, y'all. 3, not once, not twice, but 3 times. All right. And I passed on the 4th. Been a nurse for 3.5 years. The biggest thing is that I never want any nursing student or nursing graduate or nurse, anybody that's within the profession to feel like a failure or to feel like me ever. So I felt like I didn't have any direction. Nursing school was trash. It didn't help you with anything, especially when it came to nursing or studying for the NCLEX. We had HESI. It was garbage. So I didn't like it. So anyways, I created my own. It's in its pre-launch phase for $48. Once you get it forever. That link is in the bio. So be a part of the growth. All right. Be a part of the growth. Go check that out. Links in the bio. All right. Don't troll the chat. If you come in the chat and you troll, you're going to get a 600. A 600 just means I'm going to ban you. 600 means 600 seconds, which equals 10 minutes. And that's how long we're going to ban you. But in reality, that ass is banned forever. All right. So come up here, act a fool, you're getting banned. I also like to do a democracy sometimes. Okay. So sometimes I'll let y'all determine if they get a 600, kind of like Spartacus. You know what I'm saying? Thumbs down, thumbs up. You know what I'm saying? Do we keep them or do we get rid of them? You know what I'm saying? But ultimately, I'll make that decision 9 times out of 10. I'm getting rid of that ass. Okay. So here we go. And like I said, I don't gatekeep. You guys can check these out on nursinglab.com. That's where I found all these questions. Okay. But I also want to know who you are, where you're from, where you're at in your nursing journey. Drop those down. Drop it down in the comments so we know what's up. All right. And then we will go on to the next one. What was the HESI comment? HESI is trash and I don't like it. That's what I said. Here we go. 6 weeks out. Shout out to you, Becca. Just the mess says ATI is trash. I agree. I agree that HESI and ATI are trash. Oh, yeah. I hate the HESI. Oh, okay. I'm tracking. Michelle said graduated RN in December. Shout out to you. Do you remember me? Nakima? Are you talking about me? Who are you talking to? Are you talking to me? Ma'am, I'm lost. Oh, my God. I'm using ATI. You're okay. Don't listen to us. Yeah, you're gonna have to refresh my memory, ma'am. All right, question number 21. During the shift of a triage nurse in the emergency department, the following clients arrive. Which client needs the most rapid response to protect the client in the emergency from infection? All right. So from Cali, last quarter of my program, North Cali, stuck in the green light. I don't know what that means. What's that mean? You gave me your free. Oh, I did. Yes, now I remember you. Now I remember. 6 months to go. Shout out to you. Where have you been? Because obviously I see RN at the end of that. So we got a 72-year-old. We got a 72-year-old who must undergo tuberculosis testing after being exposed to TB during a recent international flight. 58-year-old who has a history of MRSA, abdominal wound infection, ill, gross. A 7-year-old with was a periodic rash and possible chickenpox infection, or a 4-year-old with paroxysmal coughing, or y'all know what I'm talking about. Obviously, I don't know how to talk. Coughing, and whose sibling has pertussis. So we got I see a bunch of C's, some C's, some D's, some A's. I'm trying to look at y'all's comments all at the same time. So let's see. It's like, yes, I passed in September 22. It's almost a year, and I work in the ED. Look at you. Well, ma'am, congratulations. I know it's been a long time because you live in Florida, right? If I remember right, you live in Florida? Jess the Mess says D. Avery says C. Vicky says C. Okay, I'm gonna give you no Phil. Oh, that's right. Is that Kevin? It is indeed. It is. Tis I. So it's him. That's me. I am him. All right, here we go. 5 seconds. Pray for me. I have a pharmacology exam tomorrow. You're good. Here we go. Here's your answer. So your answer is C. Your answer is C. A 7-year-old who has a new rash and possible chickenpox infection. Right? You were in your military. Yeah, that's right. Because were you on? I think you were an LPN before, right? I think you were an LPN, if I remember right. I'm trying. Like, there's a few people I talked to that were from Philly. All right. So, varicella or chickenpox is spread by airborne means. No, ED Tech. Oh yeah, that's right. I'm tracking. My bad. Look, I talked to a lot of folks, so you got to give me some more context. All right. Chickenpox is spread by airborne means and could quickly transmit to other clients in the ED. The child with a rash should be immediately isolated from other clients through placement in a negative pressure type of room. And that is 100% correct. All right, because who said that they don't get it? I disagree. Paranoia is violent and uncontrolled. They can get exhausted and tire out. But who am I? Yep. Who are you? You just a person that likes to fight people. I'm just playing. Yeah, I'm not saying like you like to fight people. But hey, remember, like I said, you're not gonna agree with all of them. You're not gonna agree, right? But it's about infection. Correct. It is about infection control. That's right. So let's see. Let's go back. Triage nurse and arriving which client needs the most rapid response to protect other clients in the emergency department from infection. Jessica, the question is to protect other blah, blah, blah. The question is about blah, 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 others at risk. There you go. Oh, I missed that part. Yeah. Jess, of course you did. Yeah, of course you did. But you want to come up in here and yell at people and say, I don't agree, change the question, call my congressman, this shit is stupid, blah, 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 blah. I'm just playing. You're good. But hey, what I tell you, RTFQ. What'd I do? RTFQ, y'all. All right. I'm being nice. I'm sorry. I don't mean that, Jess. I apologize. Now I get, there you go. Hey, sometimes, RTFQ, that's what I'm trying to tell y'all. I say it so much, you're never going to forget it now. All right. RTFQ. Hey, sometimes I got to get roped in and that's what I got people for. That's why I got good people looking out for me. I'm going to start saying that in my exam. You better about to get a 600, ma'am. How you going 600 me? And this is my stream. You know what? It don't even matter. Hey, y'all let Evelyn know, what RTFQ is. We're going to go on to the next question. All right, here we go. The nurse is assigned to a client who has a draining sacral wound infected by MRSA. Paint the picture, okay? Which personal protective equipment will the nurse plan to use in preparing to change the linens of the client? Select all that apply. You're going to need gloves, goggles, gown, N95, surgical mask, shoe covers. Which ones? A and C? Autumn says A and C. Don't be dead, Evelyn. That's what it means. Shout out to all 137 of y'all up in here. We're doing nursing style questions for nursing students and nursing graduates, especially for those that are getting ready to take the NCLEX. So, hey, make sure you guys let me know who you are, where you're from, where you're at in your nursing journey. Make sure you guys smash that share and like button and give me a follow because I need 10,000 followers so I can stop being ghetto and streaming from my phone like this. JC says ACE. Appreciate is it Jamari? Jamari. Thank you for the follow. Is it Yasmin or Ismeen? Thank you for the follow. Nurse Kia, thank you for the follow. Rain, thank you for the follow. All right, I'm going to give you guys 15 more seconds. Wendy, thank you for the follow. Every time I see somebody's named Wendy, I think of Wendy Testerberger from South Park. Sorry. I really think I need to get checked for ADHD, y'all. I got a lot going on. All right, here we go. Answer in 3, 2. So you got A and C. A and C are the correct answers. Gloves and gowns should be applied when coming in contact with linen that may be contaminated with the client's wound secretions. Contact precautions include the use of gown, glove, and possibly mask during clinical encounters with patients with MRSA infection. Infection control also may include keeping patients in isolated rooms or the same rooms of other clients or other patients who have MRSA infection, right? So we want to, cohort them. You want to keep them together, right? I wear a mask because it's stank. You're right. I'd wear a mask too. But you're not hey, remember, NCLEX is perfect world. So some of them, you don't got to do it. My first guess. Hey, first guess got it right. Autumn said, let's go. Let's go. Possibly a mask, but it's not an answer. True, Avery. Hey, look, Avery's very analytical, y'all. She's very analytical, right? It says possibly a mask, but for contact precautions, because it's talking about contact precautions, you don't have to wear a mask with contact precautions. According to literature, that's what it says, all right? Remember, don't give them no more, don't give them no less. Give them exactly what they're asking for. Thank you. Next. Look, all right. Now that song is stuck in my head. Here we go. Question 23. Which action will the nurse take to most effectively reduce the incidence of hospital-related urinary tract infection? So what can I do as the nurse to decrease patients getting a UTI? Make sure the client has an adequate fluid intake, educate assistant personnel on how to provide good perineal hygiene, restrict the use of indwelling catheters, or perform dipstick urinalysis for clients with risk factors for UTIs. We got C, Cody. Vicky says B. Got some C's. Rustic Valley Farm says A. I'm between A or C. Okay, you're between A or C. So which one is more correct? Wendy says B. Okay, shout out to all 113 of y'all. Make sure you guys keep smashing that like button. You know what I'm saying? Make sure you keep smashing it. You know what I'm saying? So Kate says B. Ferb says B. Autumn says B. Mayra, isn't Mayra, right? Says B. Yo Mary says, or Yo Marie says C. All right, I'm gonna give you guys 10 more seconds. In a perfect world, assistant staff know how to provide good peritoneal, but it's not B, it's C. Okay, Keaton. Keaton, you gonna die on that hill? You sure about that? You sure about that? My man Keaton is on it. He's on it today. He's on it today. Always, boss. All right, let's see. All right, I'll give you guys, here's the answer, y'all. 3, 2. So the answer is C. I know a lot of y'all about to be like, what? All right. So let's see. Let's read the rationale. All right. Don't shoot the messenger. Okay. Don't shoot the messenger. The most effective way to lessen UTIs in a hospital setting is to avoid using indwelling catheters. And that is a fact. As someone who worked in the ICU and as someone who has, assisted in infection control, I'm telling you, Foleys go in and they do CAUTI checks daily because they want them Foley catheters out. Nurses are associated with promoting policies that lessen the unnecessary use of catheters because the use of catheters is the most common cause of hospital-acquired UTIs in the United States. And that is a fact. And you advocate for your patients. Sometimes your patients need them. It is whack, but I can tell you right now, sometimes your patients need them. You can request with the doctor to take the indwelling catheter out and use an IO instead. So here's the thing about IOs. When you're doing what we call straight caths, right, is that your patient is susceptible to infections if you're going to do IOs just as much. Because let's say your patient has, like fissures, or they have blockage in their urethra, or for men, they have an enlarged prostate problem. So are we going to cause them more trauma by doing an in and out, or are we going to give an indwelling catheter? Right. But remember, on NCLEX, you have the order. The NCLEX is perfect. You have the people, you have the order, right? That's why I like to call the rule, so on and so forth. Wow, I didn't know that. I didn't know that. Are the chances still around the same, or is it a better? So you're right. It is you have 2 that won't be right, 2 that will be right, but then there'll be 1 that's more right. Dude, can you teach me everything? I get what you're saying. So the thing about it is just about making everything relevant for you to understand. I mean, PureWick. What about? No, yo, we're not gonna talk about a PureWick, but the PureWick, but not the PureWick. The PureWick, because the PureWick is not indwelling. It doesn't go all the way up to your bladder, right? That's the importance of sterile field and catheter care facts. So perineal care is a 100% a thing that is done twice a day, once per shift for peri care, with CHG. But then again, like I said, that's neither here nor there. On NCLEX, it's perfect world. You have everything that you could ever need. All right. Shout out to all 94 of y'all up in here. Question 24. A 90-year-old client is confined to the unit for 2 weeks. He has been receiving antibiotics for more than a week and says that he that he has frequent watery stool. Oh, we already know what's finna come, right? We already know what's about to come. What action should you take first? Place the client on contact precaution. Educate the client about correct hand washing. Notify the physician about the loose stool. Or get stool specimen for culture. Autumn said C. diff. Look, look, let me tell you something right now. If you ain't never smelled C. diff, it is the most glorious thing and amazing thing that you'll ever smell in your entire life. Need order for stools. Hey, remember, Keaton, you have the order. You have the order on NCLEX. You have the order. You will never forget. You're right. You'll never forget it. You'll never forget the smell of C. diff because it's great and it builds character. Oh, might change my answer. Hey, here's the thing. If you're going to change your answer, you better 100% definitively tell me that you're changing it. And you better 100% definitively tell me why you're changing the answer. And if you can't 100% tell me, you better not change it. You will never forget the smell of C. diff, GI bleeds. And yep, that's right. GI bleeds smell so, oh yeah, they do. They're bad. They're terrible. They really are. I'm going to give you guys 15 more seconds. Sticking with C. All right. Hey, my man said he's sticking with C. All right. Give. What'd I do? GIB. Angel says C. CC Work says C. 2 more seconds. If you were calling the doc, it would be for an order for C. diff culture. Okay. All right, here we go. Answer is A. Oh, I saw some last minute A's pop up in here. And I know you guys are like, what? Shout out to all 92 of y'all. We're doing nursing style questions up in here. Rocking. Yeah. Becca's just like, yeah. Myra's like, yeah. All right, let's read. So the client may have C. diff. Right? A C. diff infection based on his age, history of antibiotic therapy, and watery stool. The initial action should be to place him on contact precaution to prevent the spread of C. diff to other clients. Finally got one right. It's not contact, though. It's contact spore precaution. Hey, Avery, you are correct. However, when you take your exam, your nursing exam, it's not going to say contact spore. It'll say it's contact precaution because you have contact, airway, your standard precaution. Contact, airborne, standard precautions. Okay. So it doesn't go it's going to assume that you already know that. All right. Makes sense, but I think too much. Sometimes you just got to sit there and just, take it back a little bit. As a nurse of 9 years, it's C. On the NCLEX, it's A. Exactly. So it's not about real world. We all know that. We all know that. It should have chosen E. C was, I think, notify the physician. Yeah, notify the physician about loose stool. Right? And then droplet. Yep, there you go, droplet. So it makes more sense. Yep. Oops, I got it wrong. Hey, it's okay if you got it wrong. Remember, read the rationale so you can see, so you know what the right answer is, but then read these to see why it's incorrect. And remember, these are just questions. Most of them are going to be wrong. Most of them are going to be right. You're going to have those thieves that you're going to have a bunch that you're not going to agree with, right? But you go against the grain and be like, you know what, fuck this. This is stupid. Then, you're just going to be resentful against all the questions. And then when you take your exam, you're going to be like, oh, that's stupid. And then you're just not going to get them right. And that's not what we want. Too bad they don't have all the above. I can tell you right now that it is very rare that you will see an all the above question on your licensing exam. It's blurry to you. All right, let's see. Is it contact under diagnostic can be done? So here's the thing: is like you as a nurse, if they display the signs, you don't need an order to put somebody on contact precautions. You don't need them to put them on precautions. I would rather put them on. You could rather put them on contact precautions, and then do your labs to make sure. And then if they come back negative, then you can take them off contact precautions. It's that easy. All right. So here's our question. Question 25. The nurse is assigned to a client with meningococcal meningitis. Which information about the client is the best indicator that the nurse can discontinue droplet precautions? Right? I already jumped. Appropriate antibiotics have been given within 24 hours. Cough is productive, clear, non-purulent mucus. Pupils are equal and reactive to light. And the temperature is lower than 100 degrees Fahrenheit. We got A, best. Keyword is best. I'm going to say B. All right, Becca, I got you. Let's say B. All right. I feel very wrong. That's okay. Feel very unwrong. Because guess what? If you don't know it, you're about to find out the answer. Whether you answer it correct or not, the answer's already there. So it's best for you to answer to figure out what the answer is. That way you learn it, obtain it, retain it, Not all the above. Okay, Lauren, don't do that. No, ma'am. Okay. But retain it and then go on to the next one. This is how we learn. You have to practice, right? You have to practice. So we say D. I'm going to give you guys another 10 seconds, okay? Another 10 seconds. 10 seconds. Got B. Got B. Okay, A. Okay, neighbor nurse says D. The answer is D. Okay, you're yelling at me in all caps, but whatever, RJ, I got you. You said it's D. Woo, woo, woo. All right, here we go. Shout out to all 227 of y'all. We are doing nursing questions on here. Make sure you guys share, smash that like button. All right, I'm about to answer this question. Here we go. In 3, 2. And the answer is A. The answer is A, right? So contemporary CDC evidence-based guidelines indicate that droplet precautions for clients with meningococcal meningitis can be discontinued when the client has received antibiotic therapy with drugs that are effective against Neisseria meningitis for 24 hours. 5 out of 6, my man. That's what I'm talking about. That's what I'm talking about. Sometimes you just gotta answer it, and then you're good to go. Finally, just got one right. Okay, Avery said, "Do you ever answer these in your head and then realize you're wrong sometimes?" Absolutely. Yo, I'm going to tell all 195 of y'all right now. I am not perfect. I do not know all these answers. Like, well, y'all should have seen me when we were doing the pediatric the one before. Like, I'm like, well, I don't even like little kids like that. I don't like the kids I got. What makes you think I like peds? Okay. So, but I don't, you'll never get everything right. Everybody assumes that you're an RN. You know everything it is about to be a nurse. Absolutely not. A med-surg nurse would have a very hard time working in the ICU. An ICU nurse would have a very hard time working in labor and delivery or working in the operating room. You're not going to know everything. And I don't know everything. And I will not sit here and pretend to you. Hey, straight up, F them kids' energy. I say it every day. And I mean it too. No, I'm just playing. I don't mean it. I love them. So, but yeah, like I am not perfect and I don't expect anybody to be perfect. All right. And on this exam, on your NCLEX especially, I'm telling you right now, it is not, it's on a standard line. You just need to be a little bit better. Like it's on a 0 to 100. You need at least a 50 or above. Okay. So, is the MCAT like this? Is it GARV? I personally, sir, have never taken the MCAT because, the MCAT obviously is for med students, or for you trying to get into med school. I personally do not know what the MCAT is like. I've never taken that exam. Okay. Shout out to all 140 y'all. Appreciate the follows. Appreciate the shares. Hey, the more follows I get, the faster I can get to streaming on the computer. Okay. Do you have to know lab value for NCLEX? Yes. You do. As a matter of fact, with lab values, you need to memorize them. You need to tell me what a normal pH is. You need to tell me what the range is. You need to tell me what the range is for a BUN, a creatinine, your sodium, your calcium, your potassium, right? MCAT a lot harder. Definitely. I definitely agree. You want to know why? Because you're going to be a doctor, right? Not saying that being a doctor is easy, but I'm telling you right now, the NCLEX is fucking hard. It is a hard exam. So I don't disregard, taking the MCAT, like say, MCAT's harder. Yeah, because you're trying to be a medical doctor, but don't get it twisted, y'all. Becoming a nurse, like the dropout rate is like 65 to like 65%. Like it's a very hard profession to get into. I thought lab values are now provided on the next gen. They are provided, but let me ask you this question. And no, it's not 7.35 to 7.5, 7.35 to 7.45. They do give you the lab values. However, I need for you to know what those lab values, when they're out of range, what does that mean? I was told by my friends it's basic nursing knowledge to pass. Yeah, it is. It's basic nursing knowledge to pass. It's all about nurse safety. I'm scared to go to nursing school. Why? You applied for it. You weren't scared to apply for it. Right? I think that's only in case studies. So in case studies, they do provide the labs and they'll provide you the ranges, right? But if I give you a pH that's at, we'll say 7.29, and then I give you, a bicarbonate that's at like, we'll say like 15, and then I give you a creatinine of 2.9, and I need for you to know what the hell is happening. That's what I need for you to know. Even though I give you the ranges, I need for you to know what is happening to my patient outside these ranges, right? Do you ever do case studies? I haven't done case studies yet on here because I grabbed these questions from nurselabs.org. Oh, or nurselabs.com. So, hey, that's it, y'all. We got 25 questions. You know what I'm saying? I think that it's ridiculous that they are giving lab values even in the case study. Why do you think it's ridiculous, Kristen? Why do you think it's ridiculous? Hey, so we did NCLEX questions, right? I appreciate everybody participating. I love the gifts. I love all the attention that you guys give me. I love it. It means the world to me that you guys come here because I really do this to help y'all. 7-day NCLEX course. Make sure you guys check that out. We gave a few people some 600s today. Once again, I don't gatekeep. This all goes to Nurse Lab. I got it all from nurselabs.com. All right. Hey, but here's one other thing. Here's one. Oh, damn. Y'all already leave because they know, or they should know it off the top of their head. So here's the thing is not saying that they don't know it off the top of their head. But the thing about it is like, you need to know what it looks like after the fact. And even in real life, and that's what they're trying to do. They're trying to mirror it from real life. That's why the case studies got put in there, because they want to give you all the information that they possibly can. So I'm going to give you the lab values, right? But that's only in case studies. You can get a maximum of a maximum of 18 questions from a case study, 6 per. You'll get 3 case studies, 6 per, right? But then what if you get a multiple choice question that has a lab value in there, right? You know what I mean? So, well, don't him. Do you work bedside right now? I work in the operating room right now. And so, yeah, I worked ICU for a little over a year, and then I worked PACU for a little bit. Now I work in the operating room. So one of the best ways to study is to understand the basics of the subject and the nursing intervention. Facts. In real life, you have access to that. Yep. It's not ridiculous. Some hospitals have different values. That's very true. Some hospitals do have very different values, actually. A lot, actually. So I'm going to turn this thing around so all 100 plus of y'all can see my stinking old face, because we're done with questions for the day. And I already know what I'm about to hear. I look like Jason Derulo, but in real life, that fool looked like me. Hey, hair looking like all kind of crazy, but it's all good. What's up to all 105 of y'all? I am that dude. I am him. See, just like I said. Somebody call me Jason Derulo, him, me, whatever. I appreciate everybody coming through the live stream. Please, y'all listen to Mark Klimick. Mark Klimick's great. Not Jason Derulo. You laughing at me, Noel? Don't do that. All right. But anyways, hey, I appreciate everybody coming through. We do this every, Monday, Wednesday, Friday. Hey, if I would have got more likes, I would have did more questions. So, but I didn't get enough likes. So. Do you remember, or do you recommend, or what do you recommend for the LV and NCLEX? Well, first of all, I'm always going to recommend mine, which is in the link in the bio. The next thing, there's so many other. You can do Mark Klimick, you can do Picmonic, you can do UWorld, Kaplan, Remar. There's so many good ones out there. Thank you for what you're doing. Appreciate it. Thank you for stopping by. Archer's pretty good. There's so many other ones out there. There's so many other ones that are out there. But anyways, shout out to y'all that are here. Now that we're done with the questions, I want to know who you are, where you're from, where you're at in your nursing journey. And whatever questions you guys got. UWorld, I wouldn't say UWorld is superior, because if UWorld was superior, people wouldn't fail. See what I'm saying? Where was that?
In our room.
Hell no. Oh, okay. All right. Thank you, everyone. But yeah, if UWorld was superior, people wouldn't fail from it. Just saying. But UWorld, Archer. Somebody said something about NCLEX Bootcamp. I personally have never used them. The NCLEX High Yield is out there. There's a lot of folks that are out there. There's a lot of people that are out there. But it has that is not true. It is not a 99% pass rate. It's more like a 96. But, when you look at analytics for people that are actually passing, it's not 99. It's probably like 94, 96, but it's still high. Not knocking them. They're a great product that have been around for a long time, but it's definitely not 99%. I can guarantee it. That's like somebody saying, like, I can give you 100%. No. What time Wednesday? 5:30. Halfway through, struggling with fluid-based imbalance. What helped you for the test? Honestly, it was Mark Klimick stuff. Nope, not true. I don't know what nope, not true. What are we talking about? How did you keep your confidence when you failed the NCLEX multiple times? So scared to fail. Well, if you're scared, go to church. I'm gonna keep it all the way real. I went through the stages of failing. I went through those stages. Like, I'm a failure. I don't deserve to be here. And I said that to, a friend. I said it to a random person. Now he's like he's probably one of the best people that's ever come to my life, and now as a mentor. And he told me that, okay, well, it's your fault. And I'm gonna tell everybody that if you fail an exam, it's your fault. I'm realizing that I think ICU is my calling. Well, Avery, go there and check it out. But everything is your fault until you need to figure out what your problem is. Because it's you that's taking the exam. So what is it? An environmental issue? Like, are you not studying? Do you have distractions? Do you understand content? Do you understand and there's tons of reviews out there, but just because there's a review out there and they have good ratings doesn't mean it's good for you specifically. It took me figuring it out on the fourth try, but it also took a mindset shift as well. I got dismissed from my nursing program during my last term because I didn't have my flu shot. Well, that's unfortunate because I know that what they're going to tell you, as a nurse that, you need to be vaccinated because you want to protect your patients. And that is true, and those are the requirements. But I know some people, they get, religious exemptions from certain vaccines. So, you got to take the I failed once, dust yourself off and try again, period. You got this, facts. Yes, but the people taking reviews are people who want to be prepared and usually are. To take love, appreciate you. My problem is medication, adverse effects. There's so much out there to learn about it. All right. So I'm gonna put you on game. And this is what I teach people like in my one-on-one coaching and now in my group coaching. When it comes to learning medications, you want to put them in a category. So let's just say we have our cardiac meds, we have our gastrointestinal meds, we have our nervous meds, so on and so forth. But I'm always going to I'll always use cardiac as an example, right? So cardiac meds. So our cardiac meds consist of what? Our ARBs, our ACE inhibitors, beta blockers, ABC, calcium channel blockers, diuretics, digoxin, right? So let's just say we'll go to something simple. We'll go to LOLs. We'll go to beta blockers. Every beta blocker is a LOL. Every LOL is a beta blocker, right? All right, cool. So now I know that an LOL is a beta blocker that falls under a cardiac med. Cool. So now I know the family name and I know the suffix. Now, what does a beta blocker do? It lowers your blood pressure. But what else does it do? Does it lower your heart rate, right? What does it do? What type of lab values am I looking at? What is it going to do to my potassium? Or if I give a diuretic, what is it going to do to my potassium? Right? And now you think about the safety implications of giving that medication. Like before I give any medication, I always need to do what? Get a set of vitals, right? What if their blood pressure is 120/80? Do they need beta blocker? No. Now, what if they had a blood pressure of 180/120? Do they need it? Yeah, they probably do. So I would give it. Or what if they had a blood pressure of 90/60? Do I give it? Yes or no? Hold it. Yeah, so I want to hold it. And then now I'm thinking about the safety implications. What if I gave medication to my patient? Or what if I gave them, we'll say labetalol PO, right? Now that I'm giving them an oral medication at this point. Appreciate the heart. Thank you. Who gave me that? T-Rex, shout out to you. I appreciate that. So what if I gave somebody a beta blocker that was PO? It takes 30 to 60 minutes for a PO medication to absorb or to essentially take effect, right? So now that I gave that medication, what if your patient gets out of bed, right? And they get up too fast. Now they display orthostatic hypotension. So now they are a fall/safety risk. What if they fall? And then they hit their head. All right, cool. Now they fall, they hit their head. And now it's all about safety. You need to know what it is. You need to know the dynamics of how it affects the body. But here's the thing. It's like most of the time, they all display the same signs and symptoms, right? So once you get a broad understanding of like cardiac meds, okay, I need to think about this. Am I thinking about, the contractivity of the heart? Am I thinking about preload? Am I thinking about afterload? Am I looking at their heart rate? Am I looking at their blood pressure, right? Am I thinking about orthostatic hypotension? I'm thinking about all these things, right? And so when you follow that trend, then you're able to break it. And the more that you practice it, it breaks it down so fast, and you answer that question in like less than a minute. Okay. Yes. For NCLEX. Yes. But then also you got to think about is your pharmacology. It's never going away. Don't data dump your pharmacology, y'all. Don't data dump it. Okay. So it's never going away because you need to know what the effects of those medications are and when not to give them, when to call the doctor, what an adverse reaction looks like. Because it's all about nurse safety. Okay. So what other questions you guys got? Shout out to all 60 y'all rock with me. I'm going to hang out here for about another 15 minutes. I usually get held hostage on here, but I got some things to do. But I appreciate everybody stopping by. I heard somebody say something about, I failed. There's a term that I always say, or a phrase. It's get off the beach. And get off the beach essentially means it's, one of those things that I took from World War II that happened during the invasion of Normandy, France, when they stormed the beaches. There was, the saying that there's only two men that stay on the beach, a dead man and the man that will be dead soon. So if you don't want to die and if you don't want to continue where you are, the only way to survive is to push forward. So you need to get up from that failure, dust yourself off, and look at the objective dead in its face, and you need to run towards it, because that is the only way. You have to get off of your beach. You have to get off of your beach. Okay, ICU nurse here. You guys got this. Yep. Shout out to y'all. How to study neuro and autoimmune disorders, what to focus on. So when it comes to neuro, once again, it goes back to nurse safety, right? So neurologically, what am I thinking about? So if we're thinking about somebody who has Parkinson's or if they have myasthenia gravis, I'm thinking about, okay, like how does the disease process start? Okay, starts in the extremities, get numbness, tingling, loss of feeling, stuff like that. But then it's just like, okay, neurologically, they are a safety issue. They loss of sensation in their mouth, or stroke patients, right? Seizure precautions. It's all about safety, right? What I want to give somebody, what I allow for my UAP or my nursing assistant to feed somebody who has, like dysphagia, like difficulty chewing or difficulty swallowing. No, because it's an airway issue, right? It's also a safety issue. Sarah, that would be TB, right? Yeah, that's TB. Have you worked in a field pre-COVID? If so, what are the major changes? So I was an instructor I'm a Navy instructor. I've been a Navy instructor for 8 years. I'm a master instructor, actually. I was a surgical technologist, and I taught in a surgical technology program for 3.5 years. Then I taught in a whole bunch of other programs like ABLS, TNCC, pre-hospital trauma, tactical trauma care, and some other stuff. And then I started working as a nurse during COVID. So pre-nursing, I don't have any nursing experience prior to COVID, if that makes sense. But I've worked in a neuro, a medical, and a burn ICU. I worked in the PACU, and I work in the operating room. Sorry, this dude is in here screaming. I take my NCLEX tomorrow morning, and your videos have definitely given me hope. Look, is it Tylet? Look, you got this. First of all, if you got your NCLEX tomorrow, I don't even know what you're doing here. Go on about your business and come back and let us know on Wednesday or on Friday, when you get those results back. Bella said, currently struggling with med surg. Any tips? Not sure if you already mentioned any tips. So in regards to meds, are you in med surg, like the class, I'm assuming? So I always try to tell people, hey, he's ready for dad time. I'm about to go. I promise you. And he's just like, bro, come out here. Last time he was knocking on the door. But for med surg, here's anything I'll tell everybody that's in nursing school. Get into a group of people. Get into a group. Find your group. Find your tribe. Notice I said find it. Because, some people you're not going to vibe with. 4 people. And then break them up. Get into a group of 4 people and then break your notes up by 25%. So you do 25, they do their 25, so on and so forth, and then put your notes together. And then that's how you study. That's how you study for. Because I know med surg, the first test is 14 to 17 14 to 17 chapters, So that would be my best bet. And of course, I'm telling you right now, to split the work up, get the teamwork factor down now, because when you work as a team as an RN or even as an LVN or LPN, whenever you get out here, you want the same concept. First exam of the semester is tomorrow. You got this, Adam. You got this. So I appreciate everybody stopping by. I appreciate the love. I appreciate all the likes. You already know where we're going to be. We're going to be here, same spot on Wednesday at 5:30. Picmonic helped me with MedSurge 1. Hey, so Picmonic is good. I'm actually a brand sponsor for Picmonic. I love a lot of the reviews and a lot of the programs that are out here. I don't shit on programs. and I don't talk about bad programs. If people ask me, I'm like, hey, these are the good programs. If there's bad programs out there, I don't even talk about them. I don't talk about them at all. Okay. So, why give somebody clout for, hey, there's a bad program out there, don't go look for it. You know what I mean? So, but Picmonic is also a good one. All right. But yeah, hey, I'm gonna do my last little, what's the word I'm looking for? My last little plug for myself. If you guys are new, make sure you guys follow. I need 10,000 followers, y'all, so I can stream from the computer, so I can make this look a little bit better. Make sure you guys follow me on YouTube. Every video that I do on TikTok is going to go on YouTube, so make sure you guys go over there and check that out. Also, check out the 7-day NCLEX course. You may not need it, but somebody else may need it, or you may need it in the future. Right now, it's going for $48. You spend more on Amazon. You feel me? So do I. But you spend for $48, you get it forever. It's in its pre-launch phase, so we are consistently adding content. And right now, the main priority is getting my next generation videos up there to help you do exactly what I'm doing right now, which is breaking down NCLEX style questions more in depth. Like right here, we're going through it, we're doing it together. But with those videos, I get time to actually sit here and kind of go through things. So those videos are on the way, as well as the review is going up on there as well. So like got a lot of things, in the pot for that. So we're definitely working on that. All right. And then of course, like lastly, get off the beach. It doesn't matter where you are in life. Get off your beach. If you're struggling, get off of it. All right. Remember, everything is your fault. Doesn't matter what it is. So it's up to you to change it. And even if it's not your fault, and you still got to fix it, or else you're going to stay exactly where you are. All right. Anyway, you can remember things like C4 to C5, keep you alive, or hematocrit times 3, HGB or hemoglobin. Okay. I mean, that's good. I didn't remember it that way. I've looked at it so many times. It's just like now they're just stuck in my head. I already know what they are. Or you can think of, what is it? 12 to 16, 12 to 16 for your, 12 to 16 for your, hemoglobin. And all you need to do is just multiply all of those times 3. Yep. And then that'll give you a hematocrit. So actually, that's backwards. Hematocrit is times 3 hemoglobin, or however you said it. I'm picking up what you're putting down, though. Yeah, that's exactly how I think about it. But yeah, get off the beach and be kind to yourself. Be kind to yourself. You only got one you. Remember, when you get your license and you get your degree, it don't say nobody else's name on there. Don't say your husband. Don't say your wife. Don't say them damn kids. Don't say grandma, mima, whomever. It say your name, your last name, what degree you got. And it says your name, first name, your nursing license. So don't be letting people be out here playing with you. You're the number one priority. I promise you. And if you ain't good, you are no good to nobody else. I'm telling you right now. But I hope everybody has a really great few days. I will see you guys on Wednesday. Make sure you guys go over there and check out the review. And yeah, hope everybody is good out there, and I will see you guys later. Bye.